What is up? What is up? What is up? What's going on? What's going on? Um, real quick, you guys. Real quick, share this out. Hit the like. Hit the like. Hello. Hello, Noel. How you doing? Noel. I said no. Noel, how you doing? Good morning. Good morning. Good morning. Hit the like. What's up, proud patriot girly? Happy belated Mother's Day to you guys. Or again. Blessings, BCP and all. What's up, Linda? I'm getting my things pinned on YouTube and Facebook. Well, it's already pinned on YouTube, but Facebook. Getting it pinned. You guys, please hit the like button. Hit the like. Hit the like. Please share. Please subscribe if you haven't subscribed as well. Please subscribe to the channel if you have not subscribed. Also, you guys can follow me on Instagram, X, Facebook, obviously, Rumble. Do Rumble just in case of backup, in case anything happens. It's happened before to me. So make sure, just go to Rumble if you don't have an account, or if you do have an account, go to Rumble. Follow me there on Rumble. Because Facebook and YouTube can act funny if they so choose. And Rumble is always there. So yes, please do that as well. Please do that, you guys. I got donation links pinned on Facebook and YouTube. Super chats are open as always. I appreciate you guys. But please, yeah, on YouTube, you guys, let's continue to share the page. Like, subscribe. Those are the two most important things, liking and subscribing. It helps with the algorithms and everything. Helps with the algorithms. Good morning, Jeannie. Jeannie, good morning. Yes, please hit the like. Hit the like. Smash it. Hit it. Break it. That like, the thumbs up on YouTube. Subscribe to the channel, please. Subscribe to the channel, please. Get X really quick. Yeah, it's a new era for his show. Yeah. X. Get X open up. So, all right. All right, Coolio. Coolio. Mm-mm-mm. Let's see. Quincy, are you still going on the road soon? Like when? What do you mean? Like going to another state to cover some stuff or what? What are you referring to? What are you referring to? Going on the road, like door dashing or like on the road going someplace? Oh, on the road going someplace. I was hoping to go to DC this coming Friday, but probably not going to happen. But anybody who has donated, it's being saved for a possible, you know, future a future mission report trip, whatever you want to call it. It was just too much for DC, unfortunately, and I really wanted to be there. I probably should have somehow booked it a month or two ago, a month and a half ago, but always wait because you never know what's going to happen with politics and news and everything's like on the fly. That's one thing about this is like these type of things can't be like necessarily planned out because you never know when it comes to stuff like this with news and reporting and journalism. It's not trips, right? It's not vacation, and so you never know what's happening, and everything is fluid on this. You know, kind of like like the tornadoes. You know, you kind of know about a week in advance, but you don't know if it's really going to hit. Then you go, and it's the same way with news. You know, breaking news is like right then on the spot. Even stuff in DC when it comes to think about the inauguration in 2020. Even though it was Biden's, right, as it gets closer, they finally say, "Oh, they're not having it." Or even in 2024, what happened with Trump's inauguration? You know, because a lot of people plan to go to like these events, like inauguration, and then they changed it around and put it indoor. And then people who would usually be on the mall because of weather, right? They had to put it indoor, which only holds so many people. Then people were outside freezing. So what happened with this thing? It was just as time went, they jacked up the prices. So the airfare, when I was looking last week at this time, it was 886. The hotels were about anywhere from 300 to, and that's with taxes, 300 to 550 a night. So that'd be like $1,000 for 4 days. I'm up around $1,000. So $1,000, 1,500 for hotels, and it's just me. It's not like I have somebody else um, pitching in. So it that was going to be an expensive one, and I know it's going to be an amazing event. I was supposed to go to the Capitol on Monday, the 18th, and pray inside the Capitol. There's going to be a bunch of pastors and people, so it's kind of a letdown, kind of a bummer about that. Um, Matter of fact, I got to give Bianca a call about that. Do you ever look at packages on Expedia, flight, car, and hotel? Sometimes, um, but I don't like going through third party because in case something happens, and I've used a third party thing once and I got screwed. I'm like, I don't like using them. It was actually for the Super Bowl thing, the parade I went to, that I took my boys to. Um, I went through a third party to book the hotel, and I went to go check in, and they didn't have me booked. And I'm like, well, why didn't they have me booked? Well, on my bad, I accidentally booked it for the next night. But the hotel couldn't do nothing about it because it was through a third party. And the third party, you have to go through all these things, and they couldn't do nothing. They couldn't fix it. They're like, well, you have the hotel, send the receipt, we can refund you. I never got the money for it. It was like just to go through the hassle of it, it was too much. No, no, I'm not muted, EFO. Um, just to go through the hassle was too much to even get oh yeah, they don't return the money. They give you credit. So they give you credit to use that company again. I was like, I don't want the credit. So I lost out on $100 or a little bit more for that hotel night. That's when I went to the Super Bowl parade. Um, so I don't like to use third party, and plus, I mean, points and stuff like that. I almost had enough to get the whole plane ticket there and back. I usually fly Delta. Um, so I almost had enough money to get the hotel there or the flight there and back. But like I said, it was just everything else. Like I said, and it's I don't know. Like the channel keeps growing. It'll help. That's why I'm like, hit the thumbs up. You guys got to hit the thumbs up. Every time you have to hit the thumbs up. You have to make sure you hit the bell, notifications, all that stuff, because it helps the channel. It helps it stay in the algorithm. It helps it grow, all that type of stuff. That's why it's important to hit the like every single time, and make sure your bell and notifications are on. And make sure you've subscribed, because it definitely helps on YouTube. You pick your flight, stay in car, it's all booked and you're set. Yeah, I know Proud Patriot Girly, but it's just like I said, it's in case things happen. It's I haven't found no luck with it, with the third party stuff. And then it's also like what Jeannie said, it's a hit and miss. It's a hit and miss with the with things like, and I'm particular on where I seat. I always sit at the window, always. And depending on the deal, I might scoot up to like a little bit more leg room, but that's not really a big deal. But I always sit at the window because I sleep, and I don't like to be in the middle or on the outside, because it seems like everybody has to go to the bathroom all the time. So I'm like, nope, I'll just sit by the window, and I'm not getting out. So, and it is sometimes it can be cheaper, but you never know also what flights you're going to get. So I don't know. I usually just go through the airline. It's easy. When I go through the airline, if I want to stay another day, if I want to rebook, it's easy. They just call the number and they easily do it. Or Priceline and all that type of stuff. You can't. Pinko Pink Prick, what is up? What is up? I guess I just call you Pinko Pink Prick, even though you call me Quincy. Oh yeah, Pamperless Pam. So it must be Pam. I think it's Pam. But we'll just stick with Pinko Pink Prick. Kind of suits your name. I'm just playing. I don't know if it suits your name. Same. I have to have a window seat, so I pick my seat. And yeah, so even on if you do one of the third party apps, if you pick your own seat, I think it costs more, and it don't cost like if you go through the airline. I'm a window gal too, so we be fighting. Not just playing. I'm going home this week for my Gma's funeral. Is that in the one state I'm thinking of? Over to the east of Oregon? Yes, okay. Well, hopefully that's good. I know that'll probably be hard, so hopefully family and everything will be cool. Anyway, like I said, I got things pinned. You guys, please hit the like, subscribe, and share. Like, subscribe, and share. Steve says, congratulations on your old success. PDM, Steve Oatley? Is that who you're referring to? I haven't really had much success. I'm trying to get success, but it's working, God willing. Yes, okay. Well, tell Steve hello. PT News Network. Is he still going by PT, or did he change it? PT News Network. I need to look on that YouTube channel, because I know he probably has some old footages of me. I was looking for old stuff on PT News Network, but I was trying to look for PT News Network with like the protests and stuff. I can't find the page. I can't find the page, because I know he's going to have my original stuff on there that he streamed, but I can't not find the page on YouTube. I know, because he had like so many different Wake Up America, PT, all that. I remember the day when he got PODU for the comment about, yeah, he did. He did not like my comment on his network about Bruce whatsoever. Had to do it. It just came out. It's one of those things that just, it was there in the moment. Had to do it. I was calling him by his name. The only reason why I pushed it because he kept ignoring me. I was like, fine, I'm gonna go there, and I did. I was calling him Bruce. He was ignoring me. You guys saw it. If you remember, you saw it. He was ignoring me. And then fine, I said, you need to repent. Get right with Jesus. Bruce. I think he does his freight broker stream stuff again in the channels is freight broker sometimes. Patriot lady remembers. Yep. That was I. And I get, yeah. And I know it went viral. Like it was one of those things that was all over CNN. And I've looked on CNN. You can't even find the footage. The only people have the footage of that is Young Turks. That's the only people that have talked about me and that the video is on is Young Turks, believe it or not. Out of all the stuff, because that thing did go viral, that situation. But anyway, like I said, I'm trying to see if even if he has any of the old riots and stuff from Portland, I've been trying to, like I said, I don't know what page this is. Like, is PT News Network or what? But anyway, anyway. So, Hantavirus, what's your guys' thoughts and opinions? What's your thoughts and opinions on Hantavirus? It looks like they got to someplace yesterday, and they started unloading the boat. It's a small boat too. It wasn't like a major cruise ship. Probably was expensive. I know those like smaller ones can be expensive, like really expensive. Steve Oatley channel is where he streams. Yes, but I'm talking about the old stuff. Ooh, look at TPP getting all up, getting all bossy. I told you to look under freight broker. I did look under freight broker. I did. I still can't find it on YouTube. Let me see. I'll try again while we're here. Hat virus has been common for years. The media is focused on it. Yeah, but why? And why are they making the big deal? See, it's not popping up. It is not popping up. I mean, like freight brokers, like some freight broker frameworks. Anyway, I'll get it. So yes, so yesterday they started there's always been variations of the virus. Yeah. It's all a plant. I'm thinking it's a plant because okay, so here's yesterday, you guys. Here's what was going on yesterday with this thing. This is a 5 hour. Okay, so there's something with this thing. A 5-hour live stream. The boat doing something. I don't know what they're doing down here. I'm not gonna play it, obviously, 5 hours. Boats are going out to it. That's a Coast Guard boat. Going out to it. I don't know what it's doing. Backing up. It don't take 5 hours to dock a boat. I've been on a cruise before. I don't know how many people were on it. I do not know that yet. So this is out wherever they're at. I don't know where they're at. Okay. So what? This is an hour and 30 minutes into it, and they're still fiddling around, circling the boat. I mean, maybe they say it's not airborne, but they're acting like it's airborne. Correction, his channel is now named Steve Oatley. I'll check for that. But I don't know if the old stuff is on there. I'd have to look back and go through his stuff. Oh, maybe it might be. Past lives. 1 month ago. 3 months ago. 11 months ago. Okay, actually might be on here. I'll look through. He actually might have stuff on here 6 years ago. I'll have to take a look. He might have stuff on here. I don't know, because it's not really saying like riots. It looks like it's all this trucking stuff. It don't look like any of the riot stuff. Anyway, so yes, so almost 2 hours. The boat's still out there, and now look. Okay, so here we go. Check this out, you guys. They're saying it's not serious, or they're trying to make us make it seem like it's not serious. Look what they're wearing, and they're taking pictures of it. Y'all see what they have on? They're going out to this boat with all this gear on, right? Tell me that don't look like 2020. Tell me it doesn't look like 2020, and I'll tell you you're a liar. It absolutely looks like 2020. It 100% looks like. Look at that. You're going to tell me that don't look like 2020? I mean, I know in the doctors they do all this type of stuff, but the Andes hantavirus is contagious, but not highly. That's what these passengers have. Okay. Thank you, Snooks. Who pushing another pandemic? See, that's what I'm kind of thinking. Happy Monday, by the way, Snook. I'm willing to put trust in the admiration in this administration to handle this nonsense. Fool me once, shame on me. Oh, goodness. We have to go into the forgiveness and forgetting thing again today. Forget about it. Okay, so look, white hazmat suits. We're going to go into a tent. I'm just saying this was yesterday. It looks awful familiar. It looks awful familiar, guys. Buses. I don't know if you guys saw this footage or not. This is some of you guys may have saw it. UME. What is that? What is UME? Unidad. It's Unidad something emergencies. Hola. Hola. Thank you. CDC is with them. I don't know. Some of you guys are trusting it. I'm not trusting it yet. I'm not trusting it yet. And you'll see. Like I said, I don't know how much. Look at what's going on. If it's not that bad, why all this? They're all wearing masks. You got the green hats on the bus. I wonder why. This bus shows, and they got curtains on the bus for what? Why they got curtains? Charter buses have curtains. Got the police out here. So is that the people that just showed up? And now watch. Okay, so these are, I don't know. I don't know what's going on. So all I'm saying that this is yesterday. Okay, so this was yesterday. So do these people get like a private plane? Like, honestly, do they? I don't know. Do they get a private plane from this Unidad back to wherever they're going? They get like a whole plane to themselves, or how are they quarantined on a plane? If they're quarantined, okay, it must be pretty bad. It's right. What's up, not Tina Kotek? It is yes, what you're saying. The strain is capable of human to human transmission. Yes. To me, that seems pretty close to. I mean, here's the thing. What's more scarier? What's more deadly? Human to human transmission or just airborne? We're around people all the time. And maybe this is, I don't know, maybe this is a whole nother level up so that because guess what happened last time when it was airborne with COVID, right? We're going to we're going to break the law, and we're going to gather more than 6 people, right? I'm all good with it. Let's do it, right? So what do you think they could do now? We're going to really actually stop the gathering of people because it's human to human. I don't know, maybe it can be transferred just by sneezing. So it can be transferred by sneezing. So that in a way, it seems like they might have increased it to make it even worse. They could have made it even. They could have ante up. Yes, I'm getting there. I'm getting there. I'm all set. I'm getting there. Um, I'm going there, guys. I'm going there. Um, I don't. I'd have to look. I have to look. Mama Bear, I have to look. Um, so this, like I said, this was yesterday, guys. Let me now. Okay, so check this out. Look at these planes too. Look at the people down there. Look at the people over here on the side of the plane. Everybody has hazmat type of gear on. And they're like 40 and 50, 60 feet away. And they all have, look, over here, green boots, whole white suit. You had people to the left on the other side of the plane. Here, let me go back to it. Look, go with the camera. Go to the left. Go to the left. Go to the left. Look, police, all white, gear on. There we go. The guy, yeah, they just showed it for a second. It's called caution. Is that what it's called? It's called caution. Over here, like 100 feet away, it's called caution. All right, because it's not airborne. It's only human to human. Oh, I'm just saying, you guys, like this, to me, I'm glad you did. Yes, I'm glad you bought the gas mask for ice. It'll definitely help. I mean, it'll help for anything. The gas mask, yeah. Thanks, but I'm a bit worried having to go to a hospital with this virus there. But hopefully, it's all. Yes, That's my point. That's what I'm trying to get at. Is it different? Are they trying to make it more fearful than COVID? Like, why is the police? No, everybody is in white. So this is, like I said, this is yesterday. I guess they get the people on the plane, on this private chartered plane, to maybe start to spread it. I don't know. Look, coming off the plane, white hazmat suit. Look. it just seems for it not to supposedly, as they keep saying, for it not to be anything. So who are these people getting dressed? Are these the victims or the patients? Don't touch me. Give your hand on my back. I don't know if the people. I don't know if is there dead people? Is there dead people yet? Are the dead people on the? Is there dead people? No, there can't be dead people. Have people died from it already? What? Yep, they have. How many? No, the people died on the. Y'all are trying to say that this isn't going to be bad. There is two. That's 3 people. Okay, so 2 or 3 people. I have no clue. Just a new era, you guys. It's just a new era. That's all it is. Okay, anyway. So these must be, I don't know. I was going to say they might be patients. They might be people who were on the ship. 2 people died on a ship. Maybe they're workers. I don't know what they're doing. Okay, but anyway. So this happened yesterday. Did they transfer? What? A 5-hour stream of this. So you guys see in the boat to all of this is a 5-hour stream, 5.5 hour stream. Okay, so now people, all the police with their hazmat suits are getting in their cars. There's another plane. What's going on here? Is a bus going to stop? A private different plane or what? Okay, more people getting on the plane. Must be the scientists. I have no clue. This is on AP. That plane's leaving. Those are all leaving. Got to get someplace else. On with the production. Okay, that person just walked up with their half hazmat suit on. Could be medical staff. Do you know about medical stuff? Pinko Pink Prick? Okay, so there's a private plane. You got Coast Guard out in the ocean or whatever it is, wherever they're at, to guard, make sure that nobody gets close to the land. Right out there. That's an orange ship. Definitely Coast Guard. Everyone will be using DoorDash. Prices will go up. Okay. Okay, so this is yesterday. You guys. I'm just catching everybody up. We'll get there. As a matter of fact, you do,
como todos han podido comprobar, se está haciendo con absolutas normas de seguridad, encapsuladas las personas y sin contacto con la población local. Y a eso añadir que todas las personas que están en este crucero vienen asintomáticas y realizadas las pruebas. Significará, y eso significa también que no hay contacto con la población de Canarias, que no van a ser requeridas el que vayan a ninguna instalación sanitaria de Canarias. Y por tanto, todos seguirán su tránsito, lo que, repito, hace que tengamos absoluta seguridad con respecto a la población local, a la que hay que agradecer su consideración, su apoyo y también el entender que este es un pueblo canario que siempre está.
These are the same people. This guy right here was the same buffoon that was in the other meeting a few days ago, last week. Yeah, last week. If you guys remember, I played an update, a live breaking. He's the same guy that was there at the table answering questions.
Cuando se le precisa y hace nada, también lo queremos agradecer del gobierno de España las palabras de reconocimiento de su santidad el Papa, que ha agradecido a la población de Canarias, en este caso de la isla de Tenerife, el que acoja y haya aceptado el que este crucero haya llegado a estas costas. Las cosas van dentro de lo previsto y todo culminará seguro de la mejor manera posible.
No, thank you. We're done.
How are you going to do the transportation? There is a Swiss passenger. Is he going to go today or tomorrow?
The crew is
Swiss passenger. Okay, so whatever live stream this was, 5 hours and 35 minutes. We're going to clean the boat. We're going to demolish it. Or what's going on? What are we going to do? Okay. Anyway, that's the rest of that. Tinkle Pink Crick says that these are all medical people. I don't know. Okay, looks like there's more medical people, scientists, lab rats, or lab creators are getting on the plane. Lab creators creating something. I did not say all. Oh, okay. That's my fault. I'm sorry. Okay, you don't need to hold on the railing. Just get up the stairs. Come on. Come on. Run up, run up. Gassed out already? You're only halfway up. So this is a whole different plane. It's not even the red one that people refer. See, there's a lot going on. They're duking us. Okay, so who's this? He has a mask on and then another mask, explaining something to the scientists who want to come on. Right? Is that what's going on? I'm done. You're done with me questioning your intelligence. My goodness gracious. I won't question anything that you say any longer. I read a post that Hanta means fake information in Israel. In Hebrew, it does. Yes, in Hebrew. Okay. Like I said, this is a whole different plane. This is a whole different plane. 2026 multi-country hantavirus cluster linked to cruise ship. Oh man, this is a lot to go through. There's a lot to this whatchamacallit thing that's happening. This new, or excuse me, this old virus is not new. Allegedly, they just dosed it up more. All right, fine. So the boys in blue must be, they must be like a sterling processing type of thing. They must sterilize everything. The boys in blue or the gals in blue. So they must be like the janitors, the cleaners, right? Is that what that must be? Goodness gracious! Just don't ever question people. People can be rude to you, call you retarded, and everything else. But 4 dead from the ship. So 2, 3, or 4 are deceased from the ship. Oh man. Okay. No. Okay. Again, real quick, guys. This was yesterday. That was yesterday. Okay. So today, this morning, guys, this morning, after they, got everything figured out, after they got everything figured out, this beauty here, this beautiful plane, which went from keep in mind, it went from like a couple smaller planes to this lovely, beautiful luxury plane. Okay. This beautiful plane lands this morning in Omaha, Nebraska, guys. Welcome to the USA. Welcome to the USA. Welcome to the and guess what? Oh, all the white ones got the police escorts. What is going on? People with their luggage, got the white suits on, the white hats. Uh-huh. No, Omaha, Nebraska. So this happened this morning in the middle of the night, whatever. How come it's always in the middle of the night when they do all these kind of like transporting people?
This morning, the cruise ship at the...
You know, they do all that type of stuff in the middle of the night, transporting people from the border, transporting people from a weird ship that has something on it. All right. So I kind of got you guys briefed up a tiny bit. I don't have all the information. I got stuff coming into me. That's probably pretty important stuff. The clean team behind the scenes of our state-of-the-art Sterling processing department. So need to read into that. But looks like the people in the blue that had the blue on are sterilizing stuff. And then there's, yes. Okay. This morning, just a little bit ago, right? Let's go.
Incredibly smoothly. It's due to outstanding communication.
Omaha, Nebraska, guys.
Of everyone involved. And then I simply want to acknowledge and be grateful for their incredible hard work. The passengers who are here at UNMC are going to receive nothing but world-class care.
World-class.
It's a guarantee. You can take it to the bank. This is not the first time Nebraska has been called upon to provide the facilities and care that's required critical medical situations like this arise.
I didn't mute it.
To know that these capabilities exist in our state and that we can provide the assistance when it's needed. And I know all of my fellow Nebraskans are as well. As I could speak directly to the passengers who are now calling Nebraska and UNMC home for the coming days, we're glad that you're here. We're going to ensure that you have the best world-class care possible. We know it's been very difficult for you, one that will keep you away from your friends and your loved ones a little while longer, but you can be assured the medical are highly trained and compassionate, extraordinarily compassionate caregivers. And whatever they are, and we can make your stay as comfortable as possible, we will do. We have walked hand in hand with our federal partners from the White House to Secretary Kennedy to the CDC and all of their great teams. I am satisfied, and Nebraskans can be, that the rest of America can be satisfied that there is a strong plan in place.
What's the plan?
And to ensure the folks are secure for their initial assessment. And we're working diligently to ensure no one leaves this security in an unsecured way at an inappropriate time. No one who poses a risk to public health is walking out the front door of the streets of Omaha or beyond. Again, I simply want to say thank you again, Dr. Gold, to you and your team and all of our federal partners and state and local agencies.
No one is walking out the door. So once you're quarantined, you're quarantined. So they're going to have y'all locked down this time for sure. Y'all are not going to do the whole 6 feet thing with only 6 people and keeping your distance. We're going to lock y'all down for sure this time. According to what he just said, you know, they got a grip on it. They got guaranteed it's not going to be spread. They got a lock on it this time. That's what it sounds kind of like. Did you guys hear that too, or is it just me?
That have all had a hand in facilitating and making an impact on getting Americans back home. Thank you.
For your safety, yes, for your safety.
Thank you, Governor. And it is now a pleasure to provide some more information specifically on the operations and the condition of the passengers. I'd like to introduce Admiral Brian Christine. Admiral Christine is the Assistant Secretary for Health of the United States Department of Health and Human Services. Admiral.
Well, good morning. Thank you all for being here. Thank you especially to our partners at the Administration for Strategic Preparedness and Response. Thank you to Nebraska Medicine, and thank you to the University of Nebraska Medical Center. Thank you all for your leadership and your readiness in this response. At the Department of Health and Human Services, our approach is grounded in science.
So two deaths on the ship.
And it's grounded in transparency.
And one critical.
This is a whole of government effort across federal, state, and local partners who are all working together to ensure the safety of the American people. And let me be clear, the risk of hantavirus to the general public remains very, very low.
Hold on, who's this? He looks like is he a sailor, the captain of the ship or something?
The variant of this virus does not spread easily, and it requires prolonged close contact with someone who is already symptomatic.
8 cases, 6 confirmed, and 2 suspected, including 3 deaths total. And now, as of May 8th. So that was what? That was like 3 days ago. That was like 3 days ago.
Even so, very seriously from the very start. We've taken it seriously across HHS and particularly through the Centers for Disease Control and Prevention. And I'm proud to see many of my U.S. Public Health Service officers
I got a question.
Engaged in the response.
Here's my question. So you're on a cruise ship like this or anywhere. You're at Disneyland having fun at Disneyland because you got to love Matterhorn and Space Mountain. I do. And especially Pirates of the Caribbean. Gotta love Pirates of the Caribbean. That's a great ride. I'm talking about Disneyland, not Walt Disney World. That's a whole big galaxy. It's like the universe. It's like Walt Disney World is like officially the sun spinning through space and traveling. That's how big Walt Disney World is. You got like 7 water parks and like 5 or 6 theme parks, all within like a 50-mile square. I think it's 50-mile square. Anyway, so you're at Disneyland, you're having fun, right? You get sick. All right. Typical people get sick. Normal people get sick. We all get sick, right? How all of a sudden do you say now it's a virus and you're out in the middle of the ocean or wherever you're cruising at? And how does this go from it's just regular, like whatever, until I'm like really sick? Is it because they had the depth? Is it because they had like 2 people passed on the ship? And so now, I mean, that could be why I'm being serious. So like, how do you be like, okay, this became a real thing, like a real illness? How did they know? I'm just asking because I don't know. I'm ignorant. I'm black, slow, whatever you want to say. So I'm trying to figure it out. How did it become a real thing? Like this is we have a virus on the ship now. I've been on a cruise ship once. That was like 20 years ago. So maybe they have like doctors and a whole doctor staff, or was it patient? Was it the staff that got sick, or was it like customers? That's another question. I don't know. I don't know if they had test kits. Symptoms are the same in several people. Okay. Yes, the water parks. See, I had to bring that up. I want to go there for like two weeks to Walt Disney World because there's so much to do. But anyway, yeah. So symptoms are the same in several people. So how do you know it? How did they know it was a virus? How do they know it was like a deadly virus? How did they know it was hantavirus on the ship? How did they know? You would never go back. I'd go back. How they know? Well, yes, they have medical on board. Administrations are yelling at me! Exclamation mark. People are just rude. Some staff are sick. Okay. Don't yell at me. Sensitive. The husband died. Okay, so still could be bacterial, not necessarily virus. The husband dies on the ship. The wife was released and took a plane and dies at an airport. She supposedly gave it to a flight attendant from KLM. What? Is that true story? I'm gullible too. Is that a true story? What a mess. Could have been flu or food. Yeah, I don't. Right, it could be. See, it could be food. Yes, and that's what I'm thinking. That's where my mind is at. Like we get sick all the time. It could have been flu or food poisoning. Right. So, but then somehow it's like, oh, you guys have hantavirus out here in the ocean, and you guys just found out, and so on and so forth. What? I don't know. Seems weird to me. Yes, true story about how it spread it. Okay. Yes, it's true. Okay. Wow. What I mean? Okay, let me comprehend this again. Husband dies on the ship. Okay. We don't know why. He just dies. I mean, it could have been. How old was he? I mean, it don't even matter how old he is. People die unfortunately, at 20, 30, 40, whatever, 50 on up, right? Facts. People do. Out of the blue sometimes. Don't know. But now this person dies and, oh, it's hantavirus is on the ship. What? What? Like, seriously, what? Yeah, you have a person that does autopsies on the ship and they said it's hantavirus? It's just not, it's not adding up. It's just not. I'm trying to figure it out. I'm processing it. This is how I think. Process it. Like, intense headaches, dizziness, chills. All right. Yeah, but that's like normal stuff. My stomach was cramping this morning. Did like 100 sit-ups. I mean, it could have been something like that. I mean, like, I'm just saying that you muscle aches, things like, I don't know. I don't know. How did they figure out it was hantavirus? That's what how they say on the ship, wherever the ship was cruising at, that was like hantavirus. That's what I want to know. So anyway, it's hantavirus. We quarantine the ship. Are you normal? It depends who you ask. Probably not. I don't know. I don't sleep that much, so people would say that's not normal. Depends who you ask. I might be normal, might not be normal. Nocturnal insomnia. I don't know. I don't know. Depends. Depends on what given day. So anyway, so then they clear the ship. Everybody's in sterilizing gear, white gear, doctors, all sorts of stuff. I don't know if they're going to blow up the ship because it's out of commission now because this virus is spreading from room to room and don't want it to touch the food and all sorts of stuff. They get people on a few different private airplanes, then a big 747 plane that lands in Omaha, Nebraska in the middle of the night. And then we have a press conference, where we're at now, about hantavirus.
The CDC rapidly activated its Emergency Operations Center. It deployed medical teams to assess passengers and coordinated closely with international partners. They have notified state health departments. They have initiated exposed individuals, and they have clinical guidance through the Health Alert Network. They have also brought together national partners through coordination calls. They've developed tools and resources to support public health decision-making, and they have ensured that both clinicians and the public have clear, timely information. Transparency has been and is the order of the day. And now with the safe arrival of these U.S. citizens here in Nebraska, CDC teams are working side by side with ASPR, with UNMC, and with state and local officials to conduct assessments and provide ongoing monitoring and care. This is what strong public health system looks like.
This is what democracy looks like.
And a shared commitment to protecting the American people. We'll continue to follow the science. We will stay vigilant. We will keep the public informed every step of the way. As I said, transparency is the order of the day. Thank you. Thank you for being here. God bless you. God bless the state of Nebraska, and God bless our republic. Thank you.
Thank you so much for those words. And now it is my pleasure to introduce Mr. John Knox, who's the Principal Deputy Assistant Secretary, Administration for Strategic Preparedness and Response in the U.S. Department of Health and Human Services. And he will give us an update on planning and as we move forward.
Thank you, Dr. Gold, and thank you everyone for being here today. As mentioned, I'm John Knox. I'm the
I don't know where the
Principal
vote was
Assistant
going.
Secretary for the Administration for Strategic Preparedness and Response. I'll start by noting that what you're all seeing here today is a true partnership and a demonstration between public and private partnerships. As all of you are aware, last night, with the coordination of multiple federal agencies and in partnership with state officials, HHS supported the Department of State in a safe repatriation of 18 U.S. citizens from the MV Honduras.
Wait, hold on. What do you say?
This is a coordinated
Hold on.
U.S. citizens. HHS supported the Department of State in a safe repatriation of 18 U.S. citizens from the MV Honduras.
Okay, so 18 U.S. citizens, and where did they all go? Did they, for some reason, they all went to Nebraska? Why did they all go to Nebraska? Or did they all go to? I don't know if they all went to Nebraska, but that's where they're having this at, and that's where the plane landed.
This is a coordinated.
It's getting fun.
Safely return Americans home while protecting public. Passengers were transported via Department of State plane from the Canary Islands to Nebraska with appropriate medical capabilities on board. HHS has worked with the State Department from the start for a seamless transfer back into the United States. Upon arrival, they were transferred here to the University of Nebraska Medical Center. UNMC was selected as the U.S. entry point due to its extensive expertise in handling special pathogens, and it's the only national quarantine unit in the country.
Okay.
It is one of ASPR's 13 regional emerging special pathogen centers, also known as RESPECs, that are within the National Special Pathogens System. ASPR has established this system over the years to prepare for high consequence infectious disease outbreaks with trained personnel ready to safely manage situations like this. ASPR's mission is to protect the health security of Americans, and this response reflects the strength of the national preparedness system.
So now we know where people are going. Now we know where all of us are going once we maybe get this virus thing, right? We know where we're going. We're going to the University of Nebraska because they're the only people that have, what do you say, like the quarantine or the means to do it. That's what it sounded like.
As mentioned by others here this morning, over the next several days, passengers will undergo initial health assessment and receive guidance on next steps from the CDC experts and other
CDC experts. That's all we
This
need.
event
More
reflects
CDC
our ability
experts.
to coordinate across federal, state, and local partners when the health of any American is on the line. So at this point, I'm going to turn it back to Dr. Gold to continue. Thank you.
Well, thank
Okay, some fun facts. Fun facts. Key hantavirus death facts and recent trends. Oh, we like trends. Trends are always cool. We love trends in America. 2026 cruise outbreak. 3 passengers died after a bird watching trip. What the what? What a mess. A bird watching trip. So we just skip bird flu and go to rats. All right, whatever. Prompting an international investigation and tracking of travelers. Fatalities in the Americans. 2025, 8 countries reported 229 cases and 59 deaths in 2025, with a high case fatality rate of 25.7. Yes, a bird watching trip is where they went to get hantavirus from rats. California cases, 3 people died in Mammoth Lakes, California from HPS earlier in the year, 2025. Fatal rate, HPS Americans is highly fatal with 30 to 60% mortality rate. Transmission primarily spread via inhalation of dried urine drops. What the? Dried urine drops? Dried urine droppings or saliva from an infected oh my. Okay. Key details on the quarantine. Here we go. Here's what you guys need to know about Nebraska, because this is where y'all are going. This is where y'all are going. I'm just warning y'all. Case status. Among the 17, one tested positive for the Andes virus strain, and another showed mild symptoms. Voluntary versus mandatory. Oh, okay, here we go. So this means you can walk out the hospital if you want. While the CDC indicated the quarantine was not strictly mandatory and passengers had the option to go home, they were strongly advised to and did enter the Nebraska specialized facility that's underground, 15 stories below the surface, where they can monitor the patients. Seriously. I'm playing. It don't say 15 stories below. It does say Nebraska specialized facility for monitoring. Duration. The World Health Organization recommended a 42-day quarantine. 42-day quarantine active follow-up period, which can be completed at home or in a facility. Y'all are done. We're toast. A 42-day quarantine active follow-up period, which can be completed at home around your family, because you're not going to have plastic all up in your home. More than likely, no one's going to prepare that, and it's not going to be like ET up in your home or in the facility. Other passengers, in addition to the Nebraska group, 7 other American passengers who disembarked earlier are being monitored in various states internationally. Philippine, India, Canadian, German, and French nationals on the same ship are also undergoing quarantine or isolation in their respective home. Come on, whatever. What? Oh, this is great. This is great. This is.
Secretary Knox. We have several people here, as of course you can see. Just to introduce them quickly, we have Brendan Jackson. Dr. Jackson is from the Centers of Disease Control and acting director of the Division of
Don't worry, be happy, guys.
Pathology. Captain Michael Gardner, also from Asperger's, the regional administrator, Region 7 of the Mission Field Operations. We have Matthew Ferreira, who's a DVM and is an HHS counselor. We have Dr. Michael Wadman here from the University of Medical Center and Nebraska Medicine, and is the director of the National Quarantine Unit. We have Dr. Angela Hewlett, who's the medical director of the Nebraska Biocontainment Unit. We have Dr. Kelly Davies, who's the interim chancellor of the University of Nebraska Medical Center. Dr. Michael Ash, who's the chief executive officer of Nebraska Medicine. And by the way, thank you for hosting us. And we have Dr. Ashley Newmeyer, the director of public health for the state of Nebraska.
Okay, I got to be careful, because here's what happened before. I have to start, because I know what YouTube's going to do. I cannot be saying stuff like this, like do not do this or do not. I can't go against the CDC. They're more official than the White House. I'm being honest. I'm being honest. Dealing with this stuff back in 2020. There's things I can't do. There's things I can't say. because the CDC has a lockdown on all social media platforms, like officially, like for reals. Yes, thank you. Ryden, you guys go to Rumble now. Like, just go to Rumble. Follow me on Rumble just in case. Because if I end up accidentally saying something, because we've had the little freedom of speech, this little season of freedom of speech, kind of being able to say what we want to say a little bit, and then they kick in the rules out the blue, and I accidentally say, oh yeah, go out and don't wear this, or go out and just go to the mall, and they're telling us not to go to the mall, there goes my platform. Go to Rumble now. Please go subscribe at Rumble. Again, the BC Preacher, because this could get serious, even though they're saying it's not. It just could. It just could. You see the staff, that everybody's prepared.
Before I take your questions, I just want to say that UNMC and Nebraska Medicine are very honored to have this responsibility to repatriate these American citizens. There is no place in the country that they could be better cared for more safely and more effectively. As the governor said, it is the people of the state of Nebraska, and indeed here in this microcosm, it is the people of UNMC and of Nebraska Medicine that really make a difference to truly lead the world. Today, as you're all gathered here, there's no other place in the country where they could be more safely and more humanistically cared for.
Proud Patriot Girly, I do have my videos backed up, but all my live streams, I don't back up like my live streams. I probably should, but that takes up a lot of space. But I should. So anyway, I'll just be cautious.
We have a very simple rule.
Let's just obey what they say, you guys. Let's just obey what they say.
Here, and having served as the chancellor of the Med Center for more than a decade of my life, if we treat our patients the way we would treat family members and loved ones, we'll be okay. And that's the rule. So with that, we're very willing to take your questions. There are microphones that we will pass around. If you do have a question, I will recognize you, and there are some folks who are carrying the microphones just to be sure that everybody can hear your question. And if there's a specific individual that you want to address it to, that's fine, and you can just have volunteers.
Hi, Waverly Monroe with KETV. Just wanted to talk a little bit about, AP confirmed overnight that there was a person who was experiencing symptoms, but may have not been tested positive for hantavirus. Can you talk a little bit more about that? And is that person at the National Quarantine Unit, or is that person at the Nebraska Biocontainment Unit?
That's a good point.
That's right. So
what Jay says there is a good point. The worst place to hear someone sick is on a cruise. The air is recycled through every room, so you're breathing in every passenger's room air on board. Oh, that's gross. It sounds gross, but it's like an airplane, probably, right? In a way, the air. That's where people get the most sick, is on airplanes and stuff like that. Makes sense, though.
Part of the decision was to make sure that they preserve space within the biocontainment unit here to make sure there's adequate care for anyone who might need it among the other passengers. Passengers were flown to Atlanta for further assessment and care there.
So that person is not here?
Correct.
Okay, thank you.
So again, just to be very clear on that point, we want to maintain optimal space in our biocontainment facilities on the small chance that it becomes necessary and the individuals who are transported.
If you don't mind, I'd just love to add that we're going to expect to see people have symptoms. That's just, if you think in any given week or month, how many times do you experience some level of nasal congestion or upset stomach or something? We're being very, very liberal in how we're framing symptoms and monitoring symptoms here. And so that's how the system is working. It doesn't necessarily mean just because someone has symptoms that they're going to end up having this illness.
Yes.
Hi, Diane Gallagher, CNN. Could you clarify first then how
CNN.
many of the passengers who were on the plane from the cruise are here, and how many?
Why does it keep glitching?
Another
APP don't, or AP don't have that problem.
I can just address that briefly. So of the 18, 16 passengers are here and 2 are in Atlanta.
So they're all there.
And the biocontainment unit, we have the one who had the mildly positive PCR test. Can you explain a little bit more about mildly positive? I initially thought that we were not testing people who were not symptomatic. I know they said this person was not symptomatic. Can you go into a little bit more about what it means to be mildly positive?
Sure, and I welcome my colleagues from the University of Nebraska to weigh in on as well. But I'll note that so this passenger, this test was not collected in the United States. The specimen was collected back, I believe, in one of the islands. It was taken on the ship. There were 2 specimens. One was positive, and the other one was negative. You know, with these PCR tests, it's not necessarily.
Not necessarily
cutoff. There's sort of a range in where they can fall, and so for that reason, we want to make sure there's further testing to evaluate that at this point more.
And are there 2 individuals who stayed here, one of whom is in the biocontainment unit? Did they have prolonged contact with each other, and that's why they're both here, or what was the idea behind moving the 16 to other parts of the country?
Sorry, so 16 people are here, and for all the reasons that was mentioned. Can you repeat again what your question was related to that?
Okay, the ERA stuff, actually, it could, who knows, it might work, because I think, didn't Trump say back in 2020, like bleach and stuff would work too? I think Trump said something about bleach would work back in 2020. That was the rumors. So maybe the ERA will work, and it is low quality out here in the West. So I'd order on Amazon, order the ERA, and then let them know that you guys heard it from me. And I could probably get sponsored maybe by ERA by promoting their cheap brand that costs like $1 at the Family Dollar store or something like that. Maybe they'd sponsor me. But Trump, yeah. So maybe, I don't know if it's high quality. Or, yeah, it's because it's low. Yeah. So maybe stock up on that. Maybe ERA works instead of bleach this time. I don't know. Possibility. And wipes. Tide Pods, all that. Yes, exactly. That's love for wings. I'm right there with you. ERA? Question mark. And only Mr. Bill is not doing his job. He's doing other jobs that he should not be doing. Right? Only Mr. Bill? I think you're like the real BBB. You're actually probably more like Black Bloc at this point. Mr. Bill's starting fires and don't know how to put them out. Better get food too if you can. Yes, stack up, get the toilet paper, get the necessities, get ERA, even if you don't know what it is. Stock up.
I guess the 2 who were moved.
No, he's not instigating at Walmart.
Was it just space, or were they traveling together? Are we keeping people together since this is a prolonged contact transmission?
Got it. It may be helpful for you all to explain the difference between the sections within University of Nebraska Medical Center as well.
Sure. I'm Mike Wadman, I'm a member of the unit. We welcomed 15 passengers to the quarantine unit early this morning. One passenger did go to the biocontainment unit, and I'll let Dr. Hewlett address the issue. The 15 that were welcomed here were in good shape. They were in good spirits. They definitely were tired and needed some rest. So we did a quick assessment. We brought them into the unit. Very smooth, successful, safe transfer. A lot of coordination between our teams here, and I'd like to thank our nurses and techs in the biocontainment unit, as well as all the administrative support that we have for this, and also our federal, state, and local partners. It's definitely a well-coordinated activity, and really proud to be a part of that team. Once they're in the unit, we've been doing symptom as well as temperature checks. Everyone here is asymptomatic and afebrile, and do not have a temperature at this time. They're all resting now, and we'll do further assessments later in the day once they've had a chance to sleep. But that's where we're at with it now. But all asymptomatic, all very great for them to rest up, and then we'll do the further assessment. But to be clear, as far as Nebraska Medicine, we have 15 patients in quarantine, and we've got 1 patient in the biocontainment unit.
You want maybe just explain the difference between the two a bit more, if that's helpful.
Sure. So and I'm Angela Hewlett. I'm an infectious disease physician and I'm the medical director of the containment unit. And so with our 2 facilities, our quarantine unit is designed for well individuals who need to be monitored. It is not a patient care space. It is much more like a hotel than a patient care space. We don't have the typical things that you'd see in a hospital room. It's a much more comfortable environment, actually, with some things to help keep people comfortable, like exercise equipment, and it's a larger space, TVs and things like that. The biocontainment unit is a patient care space, and that's our unit, which is also located on this campus, and that's where we provide hospital-based care to people who need it. And those patients could range from being, relatively well and stable to critically ill, requiring multiple procedures and multiple interventions. And so we do have 1 individual who, as you know, was taken to the biocontainment unit early this morning, and I'm happy to report that we assessed that individual. They are doing well, actually. They currently do not have any symptoms and have a good appetite, although they're very tired, understandably, but it's been a really long journey for these folks. And so, again, everything appears to be going very smoothly. I'm really proud of how our team responded and how we all kind of came together to execute this very complicated, transfer of multiple different individuals into these different units.
So I might just underscore that it's a contingency planning reason. They want to make sure that other of the people that are sort of the more residential side of that need potential medical care, there is space available. And so by moving other people who may have symptoms to another location, and make sure there's that space to care for them.
Right. And then those are the preliminary conversations planning that we had in terms of bringing in a number of individuals for quarantine is when those patients develop symptoms or test positive. Contingency plan, because biocontainment capacity would not be able to accommodate 16 persons who would turn positive and turn into inpatients. So those conversations look at patients that may be identified early and travel to other biocontainment centers across the country, which is what happened in this case. Or if we have quarantine patients here and they have symptoms, positive testing, where those would be decanted to if they were stable, or would go to our biocontainment unit. All those contingency plans are in place, and the example of the 2 passengers traveling on to Emory is an example of that.
So 2 things. Camila Bernal with NBC News. How long do you anticipate people to stay here? And do they have a choice to leave, or are they being told you have to stay here for a particular amount of time? And then in terms of the 2 passengers that are in Atlanta, same question, how long are they anticipating to have to stay in this facility in Atlanta? And also that the one in Atlanta has symptoms, is the second person a partner? Just more clarity on why there is that separation between the patients in Atlanta and the patients here.
It's a great question about the plan in terms of where things will happen. So right now, the passengers that are all in the sort of assessment phase, they are going to be here for at least a few days while we do assessments and then coordination from what happens next. They certainly have the option to stay here for the entire 42-day period if that's just the safest and most effective option for them. There's going to be an individualized decision plan for them to determine if it makes more sense for them to complete their 42-day monitoring period at home. And there's going to be a couple of things that go into that decision. First and foremost, do they remain symptom-free? But then also, do they have all the structures and support to be able to continue that period at home, making sure that they can be able to isolate in a separate part of structure from anybody else, make sure that they can contact their get tested if necessary if they develop symptoms, or if they need a higher level of medical care, that's available to them. So there's a range of structures that need to be in place before anyone will be transferred to their home, and that will be done in close coordination with the health department in the states that would be receiving them.
Ultimately, though, will it be their decision?
Yes, we want to do this in the least restrictive way possible that is still safe, that protects the health and safety of both the passengers and their communities.
And then in terms of the patients.
I just wanted to make a brief comment. So Ashley Neumeier, Director of Public Health for Nebraska. Our partnership with with our federal partners has been tremendous, as it has been with Nebraska Medicine and UNMC. But I do want to just reiterate, as the governor made a comment here earlier, that we are here also to make sure that no one poses a public health threat. I do, as the team is assessing and monitoring the individuals, we understand that they've been through an unimaginable experience already, and we know there's that human element, but we also want to make sure that there is a structure in place. Safety is number one across the board here, but we are here to make sure that there is no public health risk. So,
and we've been reassured that in the event that one of these individuals who is asymptomatic chooses to finish their period of observation elsewhere in their home or elsewhere, wherever that may be, that they will be escorted under the very appropriate circumstances from endpoint to starting point.
I just want to reiterate what Ashley was saying. What you're seeing is a coordination from Washington to the state to the local levels with the governor, with here at UNMC. This is what true public health care looks like. It's important for the administration. It's certainly important for Secretary Kennedy that we work together, that there are no silos or walls between us. This is how public health should work. This is how it is working. And I think this is a perfect example of how we are coordinating, how we are speaking, how we are interfacing and doing things together for the good of the nation, certainly the good of the people of Nebraska and the good of the individuals who've been repatriated here.
And then the patients in Atlanta, are they quarantining there as well? Is there a reason other than space as to why they're there? Any explanation as to the separation?
Nothing more to add. There would be evaluation of symptoms there, and then next steps would be similar to what happens here.
And they're quarantining as well?
They're under medical evaluation right now, similar.
Hi, I'm Kaylee Schuyler with Fox News, back here. If one of the patients who's currently located here in Nebraska were to test positive, would they remain here? And is it always a 6-ish week quarantine, or can it vary?
I'll start off by saying that is why we maintain space in the biocontainment unit in event that becomes necessary. How a lot would depend upon if that was the only individual or if there were multiple individuals that would get us to capacity of the BCU. We would work with our federal partners very closely and make sure that they were transported to another facility that had the capability.
Sorry, I was just going to add on the 42-day monitoring period. The reason for that is that's the maximum incubation period that's been seen for the Andes virus. So the incubation period is the time from when someone was exposed to when they develop symptoms. That's really at the very, very long end. Most people who end up infected with this virus will develop symptoms much sooner than that. So that's a conservative time frame, and that's the number we're using. I'll note this is a much longer incubation period than we see for a lot of other viruses, but typical for hantaviruses.
Ian Lee with CBS News. You mentioned this incubation period being so long. We know that there are some Americans who already traveled back to the United States or in their communities. How can you guarantee that they don't have the virus? And can you guarantee that when people leave here, that they will not be carrying the virus?
Let me take that question. Certainly. There's been contact made with all those passengers who returned. The state health departments have been monitoring them on a daily basis, symptoms, temperature checks. They have plans in place to make sure that they can isolate effectively in their homes should they develop symptoms. If they are developing symptoms, they have ways to get tested safely and to make sure that they're not going to spread it to others. Again, based on what we know about this virus, and this, again, I want to emphasize, this is not a brand new virus. This is a virus, even though it's new to many of us, it is a virus that has been known for decades now, and there's been outbreaks that have been dealt with in other countries and even here in the United States. This is not the first time we've had Andes virus in the United States before. The data that we have now all suggests that transmission that's spread between people happens when people are symptomatic. And so I think that gives us, when they have symptoms. And so that gives us one layer of added protection to know when the risk is going to be greatest and how we can best protect health and safety of the passenger and the American public.
Can you give us more details about those other Americans? What kind of procedures are they undergoing? Are they in quarantine as well? What medical treatment are they receiving?
So they're not receiving medical treatment when they're not symptomatic, and it would only be for evaluation or testing, and more if their symptoms progress, then they would be required if it turned out to be positive, or they needed care for something else. They're following the recommendations that we have in our overall guidance for this daily monitoring and contingency planning.
And when it comes to testing, there was one symptomatic and they tested positive. With this test, they have the who has symptoms. Have they been tested? Are they confirmed positive with the virus?
So when it comes to testing, I actually will defer to my colleagues at the University of Nebraska to discuss their plans on testing. The traditional way of managing hantavirus testing has been that you really focus on testing people who are symptomatic or having symptoms. That's the current stance right now, but clearly we're going to keep reevaluating this as we learn more about this virus. And I'll turn it over to my colleague here.
I mean, we're in the process of evaluating all of the individuals, and as was mentioned, we're giving them a little bit of a rest period now, just given their ordeal. And then we are going to go back and jointly with our federal partners, ask questions about their exposure and get a lot more information from that individual. And then we will make individualized decisions on testing based on those conversations. The individual in the biocontainment unit will be tested, and that's only because that individual did have this kind of equivocal positive test previously, not in the United States. And so we will be testing that individual, but the individuals in the quarantine unit, that will be a conversation and a lot of conversations between us and those individuals that are in the unit now.
Yeah, just to add to that, in partnership
Good
with
point.
the Nebraska Public Health Lab and the university, we've developed and validated the necessary testing so that can all be done quickly.
I just say you use bleach, clean it all up.
If I can follow on what you were just saying about the individual in the biocontainment unit, has that person developed or shown any symptoms since they've been here? And do we know if there is any evidence that this could be transmitted by someone who is asymptomatic?
Oh my goodness, why?
But is there evidence that that could happen?
So first question, the individual is doing well and not having any symptoms at this time. But again, just arrived a few hours ago. And so that will be an ongoing assessment, and we will continue to ask those questions and ensure that they remain asymptomatic. And the second question was about transmitting without symptoms. So there are a lot of unknowns here, but as was mentioned earlier, it seems that with hantavirus, the specific Andes virus, that this can be transmitted person to person, but it typically does require very close contact, and typically when those individuals are symptomatic. Now, again, recognizing that, like I said, although this is, there are some unknowns, and this is not a new virus. This is not the scenario that we encountered with COVID, where we had a brand new virus. So there is some information known about this virus, and we feel fortunate to at least have that. But again, this will be an ongoing assessment. And there are a lot of moving parts right now, but we're doing our best to take care of the individuals, both in the quarantine unit and in the biocontainment unit, and make sure they receive the best care.
Just to make sure that we reiterate that even here, the quarantine center, the rooms have negative pressure so that the virus cannot leave the room generally. And then the ventilation is separate from the rest of the building. It goes right out and then it's filtered.
So that's what Jay was saying.
Air filter. So the risk to the general public for those patients who are here, even if they were to become symptomatic, is very, very minimal to none.
Very minimal,
Yeah,
but it could happen.
To add on to that also, we're doing everything in our power to protect our healthcare workers who are wearing appropriate protective equipment, both in the biocontainment unit and in the national quarantine unit as well.
And just for clarification, especially you mentioned there were a lot of people who I'm sure harkens back to 6 years ago who were watching this. What is the definition of very close contact? What does that mean?
I may let our public health partners answer that a little more definitively. They're asking the definition of very close contact and what you would consider. And the reason I bring that up is because there are some guidelines that just came out on this.
Right, so there's guidance that you can look to specifically on our website about close contact and how that defines exposures. Typically, we're talking about exposures specifically to bodily things like saliva. So if you're sharing eating utensils, kissing, touching, those type of things. It can also mean just being really, really close to that person for a fairly long period of time. So we're calling that 6 feet for at least a cumulative number of 15 minutes. I want to be clear, there's nothing magical about 6 feet. It's not a force field, but it's a rough number that gives us a sense of how close somebody has been. 15 minutes again.
Wait, hold on. Wait.
I think that's actually a fairly conservative number that gives us a sense of a cumulative number of.
Are we going to 6 feet already?
So utensils, kissing, touching, those type of things. It can also mean just being really, really close to that
Nobody
person
does that anyway.
Fairly long period of time. So we're calling that 6 feet for at least a cumulative number of 15 minutes. I want to be clear, there's nothing magical about 6 feet. It's not a force field, but it's a rough number that gives us a sense of how close somebody has been. 15 minutes, again, it's a bit arbitrary, but it again gives some sense of how close somebody's been. I think that's actually a fairly conservative approach given how we know how the evidence we should have so far about how this virus has spread in the past.
Here we go. Keep that distancing.
I have one clarification question and a few more questions. I believe just now someone said 18 U.S. citizens were on the plane yesterday. I believe officials were saying 17. I saw reporting that one person was a British national who was a U.S. resident. Can you confirm those numbers?
Yeah, that is true. The last person was a British dual national who decided to come back to the United States.
Are they in Nebraska right now or in Atlanta?
They're in Nebraska.
They're in Nebraska. Okay. And they are one of the people who are in the quarantine unit, not in the bio quarantine?
Yes.
Bio containment? Okay, thank you. And then just in terms
Why does he feel like
how
he's not happy
limited the
about having to
quarantine
lie?
is, can you talk about what protocols are? Like I'm assuming family members want to visit. Is there room for that? What does that look like?
He's not happy about this.
Currently, each quarantined individual is in a private room, their own room, and there are no direct visitation. They do have access to technology. They can conduct phone conversations, video teleconferencing with family members and friends. But no intermingling of any of the quarantined individuals. There's no visits from anyone outside of the quarantine unit. They do see our nursing staff, our technicians, our physicians on a daily basis. Of course, in full PPE, following the precautions that we have in place to prevent transmission of the pathogen, but there's no direct contact with anyone.
In terms of the bio quarantine unit, can you just quickly describe, is it similar, completely isolated? What are the differences between, how many beds there are, et cetera?
So the Nebraska Biocontainment Unit is a completely separate entity from the National Quarantine Unit, and it is designed as a patient care unit. We have 5 rooms in the Nebraska Biocontainment Unit. One of those rooms being operated as an in-house laboratory, which is actually an important aspect of our clinical care to make sure that we're able to perform our lab work in a timely fashion with a good turnaround time. The remainder of the patient rooms, so we have one individual who's occupying one of the rooms. At this point, that's the only patient that we have in the biocontainment unit. But it also, similar to the quarantine unit, it's its own separate entity. It has its own air handling system. We don't share air with any of the rest of the facility. It has HEPA filtration out on the roof. And so it's a very different facility, routine patient care room in a regular hospital. Everything is negative pressure throughout on a gradient. And there's just a lot of environmental, and engineering controls that we have in the unit that makes it just very distinct from a typical patient care unit.
And how many people can it hold?
So depending on the pathogen and our waste stream, the unit also has autoclaves, which is how we are able to decontaminate waste. And so the actual capacity of the unit is dependent on the pathogen and what we're dealing with and how much waste we're having to process out. So I know that's an interesting answer to your question, but it actually depends. For airborne diseases, we typically can take 10 patients with an airborne disease. And by that, I mean, avian influenza, MERS-CoV, something in that line. With this type of a disease and the fact that these individuals could become ill fairly quickly, as we've learned, from what went on the cruise ship. We typically are a 2 to 3 bed unit for that scenario.
And so just one more question. How often are people in the quarantine unit being tested, and what are the symptoms that you all are looking out for?
Well, as far as the testing, that's going to be decided in conjunction with the physician and medical direction team, CDC colleagues. There's no frequency of testing for asymptomatic individuals that's agreed to at this time. And then in terms of the symptom monitoring, I mean, it's all the things that you would think of in terms of an influenza-like illness, but it includes fever, headache, nausea, vomiting, diarrhea, muscle aches, generalized kind of malaise, also more respiratory symptoms, cough, shortness of breath, dizziness, things that would indicate low blood pressure. Those sorts of things are on the symptom monitoring that we do on a twice-a-day basis.
A good way to think about it would be quarantine is sort of like a very well-managed, air-handled hotel room, and the biocontainment unit is like a very well-managed, air-handled intensive care unit.
Jeff Cook, ABC News, right at the front. The 2 patients that went to Atlanta, why did those 2 patients go to Atlanta specifically, if you haven't already answered that? And what facility exactly in Atlanta are they at?
So the reason they went there is, I've discussed previously, that's contingency planning. That means if there was symptoms involved, they want to make sure that if they turn out to actually have the hantavirus, that it makes sure that the biocontainment unit here that provides medical care doesn't take up too much space in case it's needed by the other passengers who are currently here in the more residential section.
And what facility exactly in Atlanta?
Oh, it's the, I don't know if you want to speak to me. I might be able to talk about Dr. Gunn.
Great. So I'll kind of step back a little bit because this question keeps popping up as to how this system works, why people are in certain places.
What are you guys laughing at?
Asper designed this system along with UNMC, Emory, and other hospitals, which are ETECs, National Emerging Special Pathogen Treatment and Education Centers. There's 3 of those across the U.S., and this is a system, a national special pathogen system. It's not designed as one hospital does everything. So the National Quarantine Unit is here at UNMC, and it is designed to house a large group of patients or passengers from a plane or a ship like what we have now to monitor and assess them. If they get symptomatic, become sick, they can be moved into the biocontainment system and have a higher level of care. Right now, they're just being monitored and assessed. So as the system works, we have 13 RESPECs, which are the centers across the U.S., so that those patients can be distributed, load balanced across the system in one place like UNMC.
Yeah.
She said, we have 10 beds, right? But depending on the pathogen, that can change those beds. And right now we have 16 people here. We have 15 in the quarantine center.
Does it go into the mattress?
Down in Emory. So that being said, why did they go there? Because we knew somebody was symptomatic, and we have 16 people that are here. If someone were to get sick or multiples get sick, we don't want to take the time and energy, right, and lack of care transporting them to a different location. So this is how the system is built and designed so that we can do it across the system. I think that hopefully should answer the questions.
And what facility in Atlanta is it? What's the name of it?
Currently, they're at Emory University.
Back over here, Ian Lee, just a couple questions.
I have a question, Doctor.
I'm sorry, there's multiple people talking.
Doctor, how long do we have to wear a mask? Could you please let us know how long we have to wear a mask?
Is there a biocontainment unit there, and are those 2 people in a biocontainment unit or just quarantine?
Currently, at this time, it's my understanding, Matt, they are currently in a quarantine. So this is the only quarantine unit in the country right here. So
The
they
only
would need a
one. This is where I have to go.
Down there.
Wow.
Okay.
The only
It can still be used as a quarantine unit, right? Understand that?
But it's a biocontainment similar to what you have here with the
Yes.
filters and the desanitation. And all
Yes,
this.
that is correct. And it is because that one passenger was symptomatic. So that is the reason they went to the biocontainment unit at Emory. Additionally, to build on what Mr. Knox was saying, I mean, this is a system that exists for exactly this kind of scenario.
Oh,
What
man.
you are seeing is the system working. The system kind of will absorb passengers as needed. And this is a very well-rehearsed system that exists. And what you are seeing is that system work exactly as intended.
It's well rehearsed because we practiced it in 2020 and we have it perfected, and we are quarantining. And this is the only quarantine area in the country. The only quarantine hospital within the country is here in Nebraska University. And we have it down pat because it's been practiced. We tested it and we had results, and the results kind of worked in our favor, but now we've tweaked it and we know exactly what to do. And you are on strict quarantine. You cannot leave. And there is no gathering. There's not even 6 feet. There's just no gathering because of the case that you might actually accidentally hug, or you might kiss somebody. You might shake their hand, whatever. So we are completely quarantining you so that it doesn't spread. We messed up last time when we said 6 feet. That was it just didn't work. So now we are just making sure that you do not see anybody for 42 days. You're going to be locked down, and it's only at this unit. And we do have plans to expand. We do have plans to grow it. We do have plans to put it in different states with tents and with the help of FEMA. And with abandoned buildings, we can go in and we can prepare and clean it out, sterilize the building. If it's an old Walmart or if it's an old, restaurant, we can sterilize it. We have a team of blue coats. They wear blue stuff. They're highly professional people, and they can go in and clean out a building, and we can get things set up in each state so that we can quarantine people and your loved ones, so that we can stop the spread. And with that said, we want to care about the people in the world. We care about your neighbor. So just make sure that you're not going to your neighbor's house. Just wave at them from across the street. Try not to talk and say hello when you wave at them. Just sign language. Don't let anything come out your mouth, or, because when you speak, things travel through the air. And I know it's not airborne, but just in case, just precaution. And when you step outside your front door, make sure you're covered, especially your face area. Make sure your hands are even covered. It might be a good idea for you guys to wear hand protection, gloves, just in case you touch something, a door handle or mail or anything like that. Just make sure you guys are prepared. We got this, and just look for places to go to in your state if you need help. We are going to be setting things up across the country just for your guys' information.
Is this a couple? Are they together or in two separate rooms? How does that look like?
Yes, so it is a couple, and they are, I'm not sure of their exact situation. The plane just landed recently in Atlanta. The passengers were taken to Emory, but because of their situation on the ship, they were traveling together to Emory.
And just one of them had symptoms.
That is correct.
And I do have another question. You mentioned the 42 days.
Mm-hmm.
If someone recently tested or possibly tested positive, we've seen someone else with symptoms, do the 42 days start now all over again, or when do 42 days start?
So it would be a different story if the person is already known to have an infection, if it's a true, actual PCR positive. I actually like to defer a bit to our clinical partners, because I think this is something that is going to require somewhat of an individualized decision-making process to make sure when we feel confident.
So we have to be on the same page. I'm going to let them
answer. Want to add to
answer.
that or just leave it there?
Well, the day one is typically the last known exposure. And so these individuals were brought over, but they also were all wearing PPE on the plane on the way over. And so I would say, and again, we need to go in and assess these individuals. We did give them a little bit of a rest. And so we are going to go and ask a lot more questions about their exposure. How much contact positive individuals that were on this cruise ship. And so once that is more established, then I think we'll have a better idea of when day one is, because day one was your last known contact.
See, day one, this is very important. Day one.
Who was infected. And so once we get in there and actually can ask some more questions, I think we'll have a much more kind of clear idea of the 42-day period.
It's all about day one.
We've had several people over here. We've had several people already die from this virus. When they're here in the United States getting the treatment, does that change the survival rate? Are they more likely to fight and beat this virus now that they're under your care, unlike when they were on the ship?
Oh, yes, I got that question. I got that. I'll answer that question. Yes, when they are under our care, they are going to get met with the proper care that they deserve as Americans, as United States citizens. They will get the proper care that they deserve. They are coming to one of the best facilities in the nation, and they will get the proper care. They will not be released until it is completely cured from them. So there's nothing to worry about. We have some of the best medical experts here at our facility. Some of the best medical experts. We fly them in. They're here. They just live off campus. Like, we got them completely set up. Their phones are always on. They're ready to be here. Just by a phone call, they're within walking distance. And our facility is the best in the United States. We have the best care, and we will take care of these patients. Mark my words. Thank you for your question. I appreciate that. Next question, please.
Mentioned, the reason that we need these to care, whether that's here in the National Quarantine Unit or for the individuals that are already out in their home jurisdictions, to make sure that they have access to critical care, is because the real management of this disease, this is not a disease that has a whole lot of therapeutic options and things. Everything is experimental when it comes to that. We don't have any FDA-approved therapeutic options for Andes hantavirus. And so because of that, we rely on aggressive supportive care. And by that, I can mean everything from IV fluids to oxygen if they need it, to more aggressive things like mechanical intubation, even ECMO, which is extracorporeal membrane oxygenation. That is something that when people are in dire straits and really can't oxygenate their blood, then sometimes that can be a life-saving measure for people. And so these are, though, very aggressive measures. We do think that being able to provide those aggressive measures to people can change outcomes. And that's the importance of being close to this type of care and to be able to provide that critical care for individuals should they need it.
I just told them that.
Finally,
I just said that we have some of the
just
best.
for the general public, can you guarantee that no American will catch this virus from the passengers who return to the United States?
I just want to emphasize that our top priority across all levels of government here and partners is the health and safety of the passengers and their communities. And that's what we're working constantly to address through all the measures that we're putting in place.
So you can guarantee no American will catch this virus from these returning passengers.
There are no guarantees in life. We're putting as many measures in place as possible to ensure that people are safe and healthy, and we keep the community safe and healthy as well.
Just speaking on behalf of our staff and the capabilities that we have, we will guarantee that every single precaution that can be taken to keep the communities and our staff healthy, and of course to keep these passengers healthy, will be taken.
Yes.
I want to talk a little bit about the passengers.
Very clean in our facility.
What are the age ranges of the passengers, and how does that factor into the level of care? Are they part of a vulnerable population for this virus? And then also, as they then move home out of Nebraska, hopefully, does care change depending on like what part of the country they're from and what they might have been exposed to
based off of where they're being.
I'm going to let my
Yeah,
partner
our
answer this
community
question.
ranges from late 20s to late 70s, early 80s in general. And definitely, people who have coexisting disease, comorbidities would be more vulnerable. In terms of returning to their, home community, resources that are available there. I mean, one of the main benefits of being in this unit, the doctor stated, is that it's a great resource for the country and that you are proximate to critical care in a biocontainment unit that can treat high consequence infectious disease, the best. And the best teams, the best policies and procedures,
Thank you for
best
backing me
training
up.
for these things, and also the experience that we've had over the years to be able to provide this care in a safe manner. That track record, I think, is really, really one of the things that sets us apart. So if I was exposed to this and I had the option to stay in a quarantine unit,
definitely would.
proximate to that care, I would definitely take that, because you're putting yourself in a position, if you were to turn positive, it should be in a position to take advantage of all those things.
And with the people on the older end of the spectrum that you talked about, are they considered a vulnerable population or at more risk of having severe complications if they contract the hantavirus?
Yeah, generally it's thought that people who are older or have those medical comorbidities could potentially be at higher risk of more severe disease or potentially more adverse outcomes, should they get infected.
So I'm getting the message that we need to adjourn. I want to thank all of you for being here today.
Thank you,
Rest
guys.
assured that we will periodically provide some updates. I'm sure all of you from the media know how to contact our communications people
Yes.
at any time. And rest assured, as you heard said earlier, transparency is the name of the game here. We will be totally transparent, and as we continue to learn more and more about these individuals and what their plans will be.
So I appreciate you guys for being here today, and I'm grateful for my team, my colleagues here, and I'm thankful that we are on the same page. We're saying the same thing. Just trust us. We're here to look out for you as American citizens. Again, this is one of the best facilities in the nation. Nothing to worry about. We're doing everything we can do to stop this. High grade equipment, like I said, the best medical experts that anybody would want in the country is right here. We are completely 100% transparent about this. So just all you need to do is go to cdc.gov, and it might be .com. I can't remember right now. I don't have it in front of my face with my notes, but it's one of those .gov.com. And just pay attention to what we put up daily as we monitor the situation. We might have another update later today. We don't know right now, but we are doing everything that we can do to nip this in the butt so that the American population and citizens are safe. We do understand that the elderly are at risk. So if you're 50 years old and above, you might be at risk because we don't want to talk about, population control or anything like that, but 50 years old and above, it could be at risk. Just saying, make sure you guys stay in the house. Make sure you guys stay at home. Keep further than 6 feet, like really further than 6 feet. We want to really keep a big distance. We learned off of COVID-19 that 6 feet was not enough space, so we need a little bit more space in case of any just debris flying through the air from 20 feet away, 30 feet away, because you know how far a sneeze can go out. So just make sure it's a really good distance, and always wear your protective personal attire, your mask, gloves, whatever you can do to cover up, because this is how this spreads, you guys. It spreads this way. And I might be saying false information because I'm not a professional. So that's just a warning for YouTube and other social media platforms, just to give me some grace. So with that said, this meeting is adjourned, and you guys are free to go and just be cautious. Thank you guys for listening today. Appreciate that very much. Okay, I think we're done. Are we done? This is my cosplay. I think I might go down to ICE tonight, hang out with them, because I think I now see the light. I now see the light. I see how important masks are. I completely see the light, and I've been blinded. I might need to go ask for. I might not have to ask my mama for forgiveness, but I definitely need to go ask some of the people on the left that I was, unfortunately making fun of back in 2020 wearing masks. I might need to go ask them for forgiveness. Not so much my mama, but definitely some people on the left who hang out at ICE that like wearing masks. I totally get it now, because we have to protect each other. We have to love thy neighbor, and I don't want my neighbors to get sick. So might go do that tonight and just hang out with ICE protesters. Maybe not. No, I'm not going to do that. Nope, that's not happening. Okay, so anyway, hopefully you guys learned a lot. Hopefully y'all learned a lot. So anyway, that was what happened this morning, about an hour ago, 2 hours ago, at University, Nebraska Medical. That's where the press conference was. I guess 16 or 17 people came there. A couple people went to Atlanta. Everybody's back home and ready for the party to start. Iran. What about Iran? We got something else to worry about. Anyway, nothing about Iran. We got bigger things cooking. Thank you, Dr. Q. You're welcome. You're welcome. I learned from the best. of them. And it's good. And you guys, I also know which pharmacy to go to and who to speak to as a pharmacist. They will take great care of you. And you don't even need insurance. So I know who will take care of you. A pharmacy who will take good care of you. Just make sure you're signed up on the website. So we got it covered. We absolutely have it covered. So yeah, pretty good stuff. Pretty good stuff going on. Don't worry, guys. It's all covered. We could move on to a little bit, maybe more uplifting, positive stuff if you guys would like, or we can keep it. We can just simmer right here for a little while. When does the vaccine come in? The vaccine, I don't know when the vaccine comes in. I don't know. I took off my mask, so I'm off duty right now. So I can't really answer that question right now. You'll have to get back to me or get a hold of my secretary. I'm currently not working right now. So let's move on to something, I guess, more uplifting, shall we? And then I can call it and probably go DoorDash for a little bit. And I'll take you guys DoorDashing with me. Trump was on this morning, you guys. Trump was on talking about maternity type of stuff. Healthcare for women. Healthcare. I wonder if he's talking about abortion. Does he talk about abortion? Maternal healthcare. I thought men aren't supposed to talk about that. Aren't they? That's what they said. They said that men aren't supposed to. Well, the left says it. My body, my choice. Infertility. You can't talk about the women's reproduction system. How dare you? You're a man. You can't say nothing. Why can Trump say it? Anyway, let's listen to what he says. Let's see what was going on.
Most healthcare plans do not cover these benefits, but today I'm pleased to announce that the Department of Labor is issuing a new rule to formally create a fertility benefit option for employers that can be offered to all employees outside of their normal health insurance plans. It's a big deal. They were not properly taken care of. Katie Britt knows that better than anybody.
That's right.
Who called me and said, I must say, I shouldn't admit this, but the first time I really heard about the fertility was through Katie. She said, sir, we have to do something. And I'm a quick study, so I learned everything there is to learn in about 3 or 4 minutes. And I became the father of fertility.
Father of fertility.
It just made a lot of sense to me. She explained it well. And I hope you tell that story, what happened to you, that you were virtually attacked with a bad ruling from a court. They gave a very bad ruling, as you remember, in Alabama.
Yeah, but you stepped in and saved the day and made sure that we had nationwide access to IVF. And have done so much since then, and we are so grateful.
We had something passed within 2 days after
That's
that.
great.
So
That's
it's
exactly
really pretty
right.
amazing. You don't see that happen very often. But this will be supplemental option available to those who need it, much like vision or dental insurance. So we're bringing it right down into the mainstream. By offering coverage for care at every step, the fertility journey is a very interesting one, very complex it was, and we're making it much simpler. This will hopefully reduce the number of couples who ultimately need to resort to IVF because challenges can be identified and addressed very early in the process. This is a new benefit. This is a benefit that so many people have called me about. I mean, it's incredible. Oz and Bobby, I can tell you, we speak about it a lot. So many people have called me about, we have to do this. They've been waiting for it for a long time. But this is a new benefit or an option that will be a major help for millions of American moms that will result in more beautiful American babies. We like that. To further reduce the cost of fertility care, my administration has negotiated unprecedented most favored nation agreements with all of the world's leading pharmaceutical companies and nations. You think that was easy? That was not easy. The nations in particular, I tell you, I had to challenge them with tariffs. You don't want to give us what you want? I'm putting tariffs on your nation. Sir, we'll give it to you immediately. Which actually, you think Biden could do that? I don't think so. Nor did he try, Bobby, right? They didn't even try. He did not. They never tried anything. One drug commonly used in IVF has gone from, as an example, $966 to $168, a difference of 500%. This is the most incredible thing. It's not talked about by the fake news. It's sad because it's the biggest thing to happen. I think we're getting drug prices, prescription drug prices down by 400 or 500%. Or depending on the way you want to phrase the question, you could say 400, 500, 600% Oz. And you could also say 80%, 70%, et cetera. It all
okay, so I'm dumb. I'm black and slow. So the fertility thing, fertility drugs cost a fortune plus the procedure. So what is he signing in for women exactly? Like what is he? I mean, by reading this, honestly, by reading what Pink Prick says, it kind of sounds like it's like an abortion thing, but I can't see him doing that. It's not for abortion, is it? Like to help with abortion? I know he's not completely against abortion, so that's why I'm asking. What's it exactly for?
Depends on the way you phrase the question. I like the 500 better. And since we launched that website just a few months ago, it's called TrumpRx.gov. It's through the roof. Is that a correct statement? And by the way, you tell me it was your idea to call it Trump. It wasn't mine. It wasn't the president.
So is it to help people? How do we help stay at home? Is it for women to help? Like if some women have problems getting pregnant, it's to kind of help, that type of stuff. I know there's a lot of people that have problems. Yeah, it's to help women who have trouble getting. Yeah. Okay. That's kind of awesome.
They did not propose that name, but everyone else thought it was a great idea. It is working spectacularly well, incredibly effective at so many things. And there's not an American around buying medication who should not check TrumpRx.gov first. We propose, Mr. President, to save us $600 billion over the next decade, the kinds of savings we're going to achieve from the most favored nation drug pricing that Secretary Kennedy organized.
And the media doesn't write about it. If a Democrat proposed it, it'll be front page news every day for the rest of your life. The media They don't want to write about it. Think of it. We're reducing drug prices by 500, 600%, or 80%, or 75%. Anyway, it's all about the phrasing of the question. And the media doesn't write about it. It's amazing. It's so sad. It's so biased. And that's why the media,
not me.
Their approval rating went down just today, 12%. You're 12%. That's why I got elected with 97% bad stories. I won in a landslide because you have no credibility. So I wish the media would write about it. It's probably the
ladies
biggest
behind
story.
them are just
Certainly it's got to be maybe the biggest story in medicine.
Hold on.
You think.
Why? Hold on, you guys.
Drug reduction price.
Honestly, someone, okay, can we be honest for a minute? How come every time he goes to talk about something, like, let's just be honest. Can we be real, like candid, like real to real? How come every time he goes to talk about something like this, it turns out, it flips. Like we're going, and then it's like the brakes slow down, and then it's like a 180, and it points back to him. Okay, I gotta start talking about myself, what I done did. What I'm doing, what I done did. Here's what I'm doing. And he has to get the praise. He has to get the glory every single time. It's just, it's funny, but it's like, why? Like, just go with it. Keep going, sir. You're on a roll. And then it starts the car slows down, 180 and back. This is what I'm doing. This is what I've done. Nobody else would have done it. Me. I'm like, dang.
Of 60, 70, 80%. A pill that costs $10 in Germany, costs in New York City, costs $130, $140. Now the pill is going to go to $20 in Germany and $20 for us. So we're going to have the lowest prices anywhere in the world. And we can't get a story about it. They won't write it. It's the biggest medical story there is, and we cannot get a story about it. I think I'm going to ask Walmart for a little help if you don't mind. Because you people say you get very good publicity. I think if you could explain the trick and let me know. But since we launched the website just a few months ago, over 19,000 Americans have used those fertility medicines and discounts and saved more than $15 million just in a short period of time, very matter of weeks. The Council of Economic Advisors projects that the number will rise to $4.6 billion over a fairly small number of years. Nobody's ever seen anything like this. And we had to get the countries. First, we had to get the companies. And the companies were pretty good, but they knew I couldn't get the countries. So they didn't care that much. I think when we got the countries, I think they said, what's going on? And yet, they've done fine. They do more business, and they do it from, they made it up in volume, right? They made it up in volume, as the old story went. There are many other ways our administration is supporting moms and women. We passed the largest working family tax cuts in American history. By far, we passed the largest tax cuts, not only for women, for everybody, but for women. So many working women, we passed the largest tax cuts in history. We also made a historic investment in rural health with $50 billion distributed across all 50 states, and that gives each state a lot of money. Over the next 5 years, $10 billion has already been distributed, and you see the results all over the rural part of the United States, which I'm proud to say I won by about 80% of the vote. And many states are investing and approving maternal health care. Every Democrat in Congress voted against this historic funding. The Democrats, well, they suffer from Trump derangement syndrome, to be honest. They don't even know what they're looking at. They can't even see straight. But I have a new way out. I'm going to propose something the opposite of what I want, and we will have massive amounts of legislation. No, just all I have to do is
Genius idea.
we will not build the wall. And they'll go back as it is.
Diabolical.
No, I'm going to do it, Katie. We'll play it.
I think you're
I'm going to go the opposite. Whatever is bad, I'm going to go for it, and they'll approve what's good finally. No, they've got serious Trump derangement.
Call me daddy.
Which actually is a disease. I'm hearing it is actually a disease. It's an honor.
I'm the best.
Today, we're also
Great.
enacting groundbreaking childcare reforms to improve federal childcare programs, including Head Start and Childcare Development Fund that goes to each state It's big stuff. These reforms will give states more flexible, lower costs, increase options, and empower parents to choose what care works best for them. There's a lot of options that you're going to have. Under this plan, you have, I think, pretty much maximum options. And that's what we're looking for, maximum options at the lowest cost. And you've got a cost that if you were here a year ago, or if you were here like during the last administration, you're talking about a cost that would be 8 to 10 times more expensive than what we're doing. And same exact prescription, same exact medicine, same care at 10%. It'll also free up childcare funding for hundreds of thousands of additional children to support stay-at-home parents. In recognition of this ambitious agenda to support American mothers, today we're announcing a new website that is online right now. It's moms.gov. Moms.gov. You couldn't have put that in the Trump deal. You had to give me a new one, competition. This guy, he wants to make me work so hard. So explain moms.gov, would you please, Dr. Ross?
Well, we're going to have a whole discussion about it, sir, a little bit later. If we could, we want Katie to speak a bit about the first issue you mentioned. But moms.gov is a beautiful site. Folks want to check it right now while we're talking.
Yeah, you really should. And it's pretty incredible. Something that
Moms.gov.
Senator Rubio and I tried to
All
do, sir, but you're the one who actually did it, along with.
Well, I like TrumpRx.gov.
I feel like that.
I mean, I love moms. I love moms.
Just call
but I
me
like
daddy. I like daddy.
TrumpRx. You put me in there. I got to make sure.
Just daddy.
Competition now. You want to work?
That's what I like.
That's all right. We're only kidding. I have to say we're kidding. Otherwise, they'll do. Trump and us had a major dispute. It was terrible. When Bobby broke them up, it was a terrible, terrible dispute. These people. I encourage every mom to visit this new page where they will find helpful information about addressing clinical care, pregnancy resources, nutrition tips, Trump RX, and Trump accounts. Trump accounts has been amazing for the kids. It's Michael and Susan Dell. They put in $6,250 million started it, and that's another one that's gone through the Trump accounts, where young kids, they turn 18 or 20 or 21, and they feel like a billionaire. You used to say a millionaire, now you say a billionaire.
Yeah, because millions is nothing no more.
They feel rich, as opposed to having absolutely nothing. It's so popular. So many people are doing it. We have people, in one case, took over the entire state of Ohio. It's putting up the money for every kid in the state of Ohio. Supporting the journey of American moms at every stage is so important to the success of our nation. I'd now like to ask Senator Katie Britt. She's the one that got me into this, I have to tell you.
I gotta tell you.
She always remains loyal to me, so I can continue to support her. I would hate to go against her.
Where's Rubio?
That will never happen, Katie, right?
That's right, sir.
But to say just a few words, she's really a fantastic woman. She's a great senator. And I got lucky. I was supporting somebody else, and then I realized that the somebody else wasn't very good. And I said, who's that young woman I met that was so impressive? They say, her name is Katie Britt. I said, let me talk to her. I talked to her. I endorsed her. She won a landslide. And you've been winning in landslides ever since. So you've been doing a great job, Katie. Thank you very much. I thought I should explain it.
Thank you.
To say a few words, Katie's going to say, and followed by Monique Pruitt, and then Olivia Walton, then Dr. Oz and Dr. Dorothy Fink, and Dr. Alex Adams. And you'll speak not too long because I am being waited on by a large group of generals. And that's also important, having to do with the absolutely lovely country of Iran. That's the way they pronounce it.
Well, we will get started then.
Okay.
Mr. President, thank you for your work. We are here, guys. This is another example of promises made, promises kept. We look at what President Trump did when we dealt with this issue in Alabama. He stepped up to the plate immediately to make sure that we had nationwide access to IVF. to making sure that we had comprehensive fertility treatment so that men and women, couples who were longing for their child, could continue to have that hope and also have that reality. Today doubles down on that yet again. I mean, we see the savings that have happened across the country, and I've had more and more people come up to me and tell me a story about what it has saved them. But we also know that there was opportunity for continued growth. President Trump saw that and he acted on it. So now more people are going to have access through their employer, just like they would dental or vision insurance. And there are people right now who this is out of reach because of affordability, and President Trump is bringing that back in. When you look at the comprehensive nature of what we're doing today and coming on the heels of Mother's Day, I mean, we are thrilled to support mothers everywhere. Whether it's that mom that is getting to experience growing life for the very first time, or the one chasing toddlers or wrangling teenagers, or being there when their adult child calls for advice. Moms are the heartbeats of our families, our communities, and our country. President Trump knows that, and he's made sure we've created a comprehensive culture of life. That's what you see right now with moms.gov. Moms.gov was something that then Senator Rubio and I talked about doing with Senator Kramer and now Senator Schmidt. But of course, President Trump is actually the one to put it into action. It supports moms through the prenatal, postpartum, and early childhood development stages of motherhood. Also, as we tackle rural health, look, I stand up here in front of you not only as a mom of two, but also as someone who lives in the great state of Alabama, where about 28% of women live in a maternal care desert. The work that we did in the Working Families Tax Cuts, guys, that hits it head on. We have an opportunity now to reach those who haven't been reached. When we look at maternal mortality rates, we continue to invest both in the research that will help us resolve that issue, but also in the women that deal with so many issues during their pregnancy. We want them to be supported. And then in addition to all of that, childcare. So we know last year alone, you had about 455,000 women leave the workforce due to affordability and accessibility of childcare. We've often said, and the president and I have talked about this, if you have or want the opportunity to stay home, we want that for you. But if you want or need the opportunity to re-enter the workforce and want to be a part of building back America, like President Trump is doing, we don't want affordability or accessibility to be an impediment to that. So not only at his direction, and I was proud to lead the effort in the Working Families Tax Cuts to modernize the tax code to make sure that childcare was front and center for the first time since Ronald Reagan, sir, you're the first one to do it. Yeah. But today, that comprehensive nature of whether you're staying home or you're in a faith-based provider or you have a child care center that you lovingly send your child to during the day as you work to provide for your family. Today, that is easier as a result, and we are proud of what that means for the economy. We know 24% of young families, young families spend about 24% of their annual income on childcare. So, Mr. President, thank you for all that you've done creating a comprehensive culture of life. This is really groundbreaking.
So do you see now why I endorsed her? So
it's groundbreaking.
And always will.
I like
it. She also is married to the largest human being I've ever met. Her husband is great. He's a 11-year player in the NFL, an all-star, one of the greatest college football players.
I like it.
Ever at what he does. So he's a fantastic person. Both two really fantastic people. Monique Pruitt speaks about Trump RX.
Yes, sir. Well, thank you, Mr. President and Senator Brett, for all the work and the teams that have done so much around this. This is a very important topic, so glad to be here. I personally use Trump RX and have saved thousands of dollars on my medication. As President Trump mentioned, a lot of insurances did not cover this. Looks like they will be now, so that's wonderful. Thank you. Even so, some don't cover the medication portion. That can be a separate pharmaceutical cost. So Trump RX has brought a lot of the prices of medications down. For me personally, Gonal F has been one of the main medicines that people use for egg retrievals, and that I cannot find it anywhere on any other website or for cheaper. So thank you so much to you guys for doing all the work. We really appreciate it from the IVF community.
It's been amazing, hasn't it? The difference in cost.
Very amazing.
It's just incredible. I mean, you're talking about something that goes down 5, 6, 7 times.
Great word.
And I tell the story often. I was so proud. My first term, 1/8 of 1%. I reduced drug costs during my third year. 1/8 of 1%. And that's the first time in 28 years that prices went down. And I was so proud.
They all just admired Trump.
Remember that? Ladies and I'd like to just say that prices have gone down 1/8 of 1%, which is the first time in 28 years that prices have gone down for prescription drug prices and other. I was so proud of that. And now I reduced them by 500%. Perhaps that's experience. I always knew that, we were being just absolutely decimated, but, I was hunted. I was the hunter. Now I was the hunted then. And I had to devote a lot of time to that. Otherwise, I wouldn't have been too effective. If I was out of office, I wouldn't have been. I was hunted by some very bad people. Now I'm the hunter. It's much better when you're the hunter, but these are bad people, and they'll give you no support at all, no matter how good it is. I mean, as an example, I don't know what the numbers are, but if we go to Congress to get something approved, which we get, but you can say that we're going to reduce drug prices by 80%, and we won't get one Democrat vote. I don't know how they get away with it. That's why we call them the Democrats. We have they're Democrats because they're dumb. They're dumb people, and
smile.
And they just can't do it. I've been waiting so long for them to change, but they just keep losing, and they're going to keep losing with their policies. But we reduce prices by 70-80%, and it's such a big deal. I'd like to ask Olivia Walton, who's here with her very handsome husband, Tom. Thank you, Tom, for being here. Thank you very much. And you're going to speak about maternal health care.
Mr. President, I'm going to introduce Olivia. If you're on.
Okay, good.
Before we leave the last topic, it's the leader of EMD Serrano, which makes one of the most important fertility drugs is here. Just to remind you, because you've been giving different percentages, the Monique's price of getting a product is 1/10 of what it used to be. So 1/10, forget about percentages. It's an easy number to remember. And the fact that we were paying 10 times more for that same drug in America is embarrassing. It changed under the president, and presidents have known her for a long time, but it takes guts to take on important lobbies.
So why didn't they get it done?
Well, the main reason is they were intimidated. They're scared.
Or incompetent.
Or incompetent. But I've had plenty of conversations with the president when he says he doesn't care, he wants to do the right thing, and this is a good example.
Q.
Excuse me, Katie Britt's husband.
Q.
Get it? I just spotted this very large answer. That's a great guy. Okay, go ahead.
So let me speak a little bit about the reality that 1 in 3 Americans are underbabied. What does underbabied mean? That means that you either don't have any children or you have less children than you would normally want to have. And to Katie's point, we have a crisis that's causing our fertility rate to drop below 1.5. The replacement rate is 2.1. So we're way below what we need just to replace the people that we have in America. And one of the challenges is that rural America, where there's 60 million people, have a mortality rate, maternal mortality rate when they have babies that's about 30% higher than even in an urban area.
Welcome, Darlene.
One of the ways the president wanted to address this was creating something in the Working Families Tax Cut legislation, which is, I think, the most ambitious, fantastic program ever written to help fix the healthcare system. The president saved Medicaid in the Working Families Tax Cut legislation. He also invested with Congress's help, and Senator Britt and her colleagues voted for this of the House, to put in $50 billion into rural health care. That's $10 billion a year for the next 5 years. All the money went out the door on time, and it's being used for incredibly beneficial advances to help Americans living in rural America have babies safely. Your zip code should not determine your mortality rate if you're having a baby. That is going to change. There's a great program in Southern Alabama. They call it LA, Lower Alabama.
I love that you know that.
Yes, I've been there. And that is allowing us to use these new ultrasound probes now. If you don't have an obstetrician in your county, because in many counties in LA, which is Lower Alabama, that is the case. We have states and all the governors are embraced on this, investing a lot of money, training more people to work in rural America. And we're also using telehealth tools. So you have big, sophisticated urban centers adopting smaller facilities and clinics so they can help moms deliver babies wherever they may live. You don't have to drive across state to get there. Now, as great as this all is, and as fantastic as it has been,
this is very educational. And it's, just for the record, it's daddy. Okay. Great. I'm the best. I've done everything. It's daddy from now on. Daddy. I mean, it's Daddy Trump. Why not be Daddy Q? I'm just saying. Let's keep it equal. Equality. Equity.
50 governors. In this case, Mr. President, even the Democratic governors are on board. It's such a good offer. It's such a beautiful way of keeping your people healthy that everyone's embraced this program. We still can't do it by ourselves. We have to invest in the American people. We have to have governors and private sector partners that make this happen, as well as, and I hope the Secretary can speak to this in a moment, because MAHA is probably vital to this effort. You have to get moms healthy enough to do the most creative thing the universe knows, which is making babies. So Olivia, maybe you can take the message around the private sector involvement and how you and your family have gotten involved in this and led the way, and maybe you can talk about MAHA afterwards.
Sure, I would love to. And first, thank you so much, Mr. President. Thank you, Dr. Oz, and thank you, Secretary Kennedy. Thank all of you for making maternal health really a national priority. It's an honor to be here today with all of you. This $50 billion in rural health funds, this really represents a transformative opportunity to invest in maternal health care. And in fact, it's what's given us the confidence to launch Healthy Moms, Healthy Babies America, which is our campaign. It is bipartisan. Dr. Oz is right. Democratic governors across the country are also very interested in doing this. We have a simple goal. We want to cut the U.S. maternal death rate in half in 5 years. That sounds audacious, but I am confident we can do it. I am confident because we have the federal leadership, because President Trump wants to make America the best place to have a baby. I'm confident because we now have this $50 billion, money that's already going out to the states that we can actually leverage to pay for some of this. And I'm confident because honestly, we know how to fix this. The vast majority of infant and maternal death is preventable. We know the solutions. Maternal health is rural health. You heard the numbers from Dr. Oz. I'm here today as a mother from Arkansas. I have 3 young kids. I live in a very rural state, and I'm thrilled to say Governor Sanders is taking maternal health head on and has made some incredible progress. But in rural America, it is hard to have a baby right now. It is hard to get care. We have moms driving for hours to get to the OB. Most moms don't have the time to do that, and a lot of moms don't have the money to do that either. And then after they have the baby, they're not going back for any kind of checkup. For those of you who know who've had a baby, what's the standard of care? They say, come back in 6 weeks. It's not a good idea. You all know how precarious those precious few weeks are. You need help sooner than that. And by the way, not all this care has to be done by an OB. It can be done with doulas and nurses and midwives, folks in your community. They can work with the doctor. As Dr. Oz said, there is virtual care. The solutions really do exist. And now is the time to get serious about this stuff and scale it. So we are uniting business leaders with policymaker, healthcare providers, faith leaders. We believe there's a great opportunity for faith leaders to play a bigger role in taking care of babies postpartum. And I'm just grateful to be here. I really believe, I know you're meeting with the generals, and we appreciate you keeping our country safe. Investing in maternal health care is the most strategic investment we can make in the future of American prosperity. So thank you.
Hey, Tom, she did very well. What do you think? I'd give her a 10, maybe a 12. I'll give her 12. So when is she running for office? You know, the nice thing, I just listen, as Olivia was saying, she's so respected, and she doesn't need this. She doesn't need to come here and go, and she goes around and checks hospitals and does things. She really doesn't need it at all. She could be doing anything she wants. Anything. And I think it's fantastic. And thank you very much.
Kind.
Thank you very much.
Thank you.
Really beautiful. Okay, we have Dr. Fink.
Oh, yes, right here.
Dr. Fink, how
So
are you?
good to see you.
Nice to see you. Go ahead.
Well, thank you, Mr. President, for your ongoing support of maternal and infant health.
Hold on.
We recognize that the
My daughter-in-law is driving 2 hours just to be seen during her pregnancy. She had only been seen 4 times, and she is due in July. She can't even get a ultrasound. What the what? What the what? Can't even get an ultrasound? Why? Because the place don't have it, or what? That's messed up. That's not cool. That's not cool.
health of women and mothers are so deeply interconnected. That's why we launched the Perinatal Improvement Collaborative during the first Trump administration, an effort that has continued to this day to improve health outcomes for moms and babies. Through this nationwide network of hospitals, we are using real data and proven clinical practices to protect mothers and newborns. In the Perinatal Improvement Collaborative hospitals, we have reduced maternal mortality by 41.5%, which is truly incredible. And this is compared with a 5.9% decline in benchmark hospitals over the same period of time. Our goal is to have every hospital in America doing this, and we're thrilled to be partnering with Heartland Forward to make this happen. We really want every woman to have a healthy delivery and a healthy baby, and to make the United States the healthiest place in the world to give birth.
Okay.
Yes, and I'll also add in that you all and the Trump administration have taken historic steps to really strengthen support for American mothers and families. With the launch of moms.gov, we're highlighting all of the policy achievements that both you, President Trump, and Secretary Kennedy have advanced to support moms and babies. Moms.gov is the first of its kind resource that offers all sorts of guidance and information to support the health and well-being of mothers and their families. Moms.gov also really helps support expecting parents who are navigating difficult or unexpected pregnancies. We are committed to supporting women's health throughout motherhood and at every stage of life. Supporting women's health is not just a policy, it's a promise. We know that healthy mothers help build healthy families, and that healthy families build a healthy America. So I want to thank you, Mr. President, Secretary Kennedy, and everyone here for your support of women's health.
Thank you, Doctor, very much.
Thank you.
Well done. It's well done. Dr. Adams, please, about childcare.
Thank you, Mr. President. This Mother's Day, we recognize the reality for millions of Americans, and that's childcare has become too expensive, too difficult to find, and too disconnected from the needs of working families. For years, Washington's answer has always been the same: more bureaucracy, more mandates, and higher costs for everyone. President Trump, you are taking a different approach. Under your leadership, we're advancing a child care reform package that puts parents back in charge. We're going to do three primary things. First, we're restoring parental choice. That means bringing faith-based providers back to the table. And it means recognizing the vital role played by home-based providers, relatives, and parents who choose to stay home during the earliest years of their children's lives. Second, we are cutting unnecessary red tape that forced providers to close, limited access to care, and made it harder for working families to find the support they needed. We're moving away from one-size-fits-all federal mandates and instead empowering parents to meet their child's unique needs. And then third, we're strengthening accountability to ensure taxpayer dollars are protected from fraudsters. Under the Biden administration, they essentially backed the Brinks truck up to states and sent the security home. We think Americans deserve better. We will ensure that these funds go to families who truly need support. Our goal is simple: more affordable options, more providers, more choices for parents, and more accountability for taxpayers. Mr. President, your pro-family agenda recognizes a simple truth: strong families build a strong nation. And if I could just add on a personal note, Mr. President, I want to thank you for your leadership and everybody out here for their leadership on fertility issues. My beautiful baby girl, Emerson, is a product of IVF, and I thank you for your leadership on that issue and sharing the joy of parenthood with many, many more American families. Thank you, sir.
Well, thank you very much, Doctor. It's great to know. It's been really successful under this administration. And again, Katie, you were so helpful. Bobby, do you have something to say?
Very, very briefly, Mr. President. I just wanted to stress what a huge win for the MAHA movement and for the pro-life movement moms.gov is. It is one-stop shopping for IVF, for prenatal care, for postnatal care, for nutrition, for baby formula, and of course for Trump RX. We have, as Dr. Oz pointed out, a fertility crisis in this country right now. We just found out that we've dropped out of 1.57%. The replacement rate is 2.1. 100 years ago, we were at 3.27, so more than double that we are today. We are approaching the cataclysmic rates that Japan and China are now experiencing that is threatening their economy. It's a threat not only to our economy, to our national security, it's a direct threat to our Social Security Trust Fund, to the Medicare Trust Fund. President Trump has directed my agency to find out the cause of the fertility crisis, and that is part of this program. We're looking at the impact of metabolic challenges which directly affect fertility, of obesity, which affects fertility, of endocrine disruptors, of pesticides, of this toxic soup that our young women are walking around today to try to figure it out. The fertility crisis for women began in 2007. For men in 1970, men had twice the sperm count as our teenagers do today. This is an existential crisis for our country. We had a series of presidents that were trying to discourage childbirth and motherhood in this country. We now have a president that is trying to encourage it. And I want to thank you again for your leadership.
Thank you very much, Bobby. And there's another word, autism, that we're very much involved with. And I have my own ideas, but Oz and Bobby and everybody, they're really focused on it very hard. I think in a certain way, I would like you to look at the payment schedules, Bobby, because I think it's very skewed because of the payment schedules. You understand what I mean?
Yes.
We're bringing you some ideas.
I think it has to be. I think it's crazy. I think that's what's happening. Can't pay more for that to a doctor. I mean, every person around is going to have autism. That's what's happening. So, because I really believe that that's very badly skewed. But more importantly, but I would like that done immediately. But more importantly, I think that some great progress has been made as to why, what is this thing that's happening all over the world, but here, what is it? What's going on? And there has to be something because it spiked so much over the last 10 years. It's spiked over the last 15 years. It's gone up many, many times. And I think it's a very important thing to mention. I mention it all the time, having to do with other subjects, and then I bring in autism. Anything having to do with medical, I always bring in autism. On another topic, we're looking very seriously at natural 7-OH and getting that approved, natural 7-OH. And we'll take a look at that very strongly. I think Oz and everybody were looking to see if we can do something there. A lot of people are asking for it. And thank you very much for the work on that. And with that, do you have any questions?
Mr. President, you mentioned that you were at the meeting with the generals on Iran. You rejected a deal from Iran over the weekend. Can you tell us anything about that proposal and what, if any, effort was made to break this deal?
Yeah, it was just unacceptable. A lot of people said, well, does he have a plan? Yeah, of course they do. I have the best plan ever. I mean, Iran has been defeated militarily, totally. They have a little left. They probably built up during this period of time. We'll knock that out in about a day. But I have a plan. It is a very simple plan. I don't know why you don't say it like it is. Iran cannot have a nuclear weapon. They're very dangerous. They're very volatile. It's a terrible thing that's happened over there. They've killed 42,000 people in the last 2 months. 42,000. At least that's what we know.
Why do they go from
42,000 people? They killed numerous.
Why do they go from talking about fraternity type of stuff and women healthcare, and we flip it? The first question is Iran. I mean, Iran and all this is still important, but like, wouldn't you want to address the situation that what you were there for? Like, for questions. Hey, anybody have any questions? Oh yeah, Iran. Come on.
People over the last week. But they killed 42,000 people a month and a half ago. They were unarmed protesters, not at all violent protesters. And they started taking them out, shooting them. So we're not going to let them. That's the plan. People say, what's the plan? The plan is very simple. The blockade, first of all,
you don't like moms.gov?
Was a part of military genius, just like Venezuela was military genius. We have the greatest military in the world by far. And we're stocked up with great ammunition. We have much better stuff than we did 2 months ago when we first did the attack, which knocked them for a loop. But very simple. Iran cannot have a nuclear weapon. Can't have it. And if they did have it, the Middle East would be gone, Israel would be gone, and then hit Europe probably next. We're doing the service to the world. And this has gone on for 47 years. Other presidents and leaders of other countries that have the power should have done it, but they didn't do it. But it's a very simple plan. Iran cannot have a nuclear weapon, and they won't have a nuclear weapon, and they
Mr. President?
didn't want to go that far.
Because
If you can believe it, they didn't. How stupid? Are they stupid people? They didn't want to believe it. They think that, well, I'll get tired of this, or I'll get bored, or I'll have some pressure.
Are they stupid?
There's no pressure. There's no pressure at all. We're going to have a complete victory. We've already, in theory, had a complete victory from the military standpoint. The military, look, their Navy is dead. They had 159 ships. Right now they have 0, other than the little speedboats that go around that got taken out 8 a day by us. They have no Air Force. They have no anti-aircraft. Now, they probably put the shoulder jobs into service over the last 3 weeks, probably. But essentially, they have no anti-aircraft. They have no radar.
Under Trump.
And frankly, their leaders have been killed at the first level, second level, and half at the third level. And then they come back and they want to negotiate, and they give us it's a stupid proposal, and nobody would take it. Although Obama would have taken it, Biden would have taken it. What they took was far worse. So we stopped them twice. We stopped them when I terminated the worst deal probably ever made in the history of our country in terms of defense. That was the Iran nuclear deal penned by Barack Hussein Obama. That would have given Iran a nuclear weapon within a year. They would have had it years ago. I terminated that in my first term. And then when that beautiful plane right there hit them hard, we really hit them hard. And they told me, I want to just tell you this because they like to say, oh, well, maybe it wasn't that hard a hit. Iran told me very strongly, because they intend to give us the nuclear dust, as I call it. It's easier than talking about other terms because it's a term everyone knows. But the nuclear dust, which is what we hit, they told me, number one, you're getting it, but you're going to have to take it out because the site was so obliterated that there's only 1 or 2 countries in the world that could get it. It's so deep and got hit so hard that there's no way they have the equipment to move it. You and China are the only 2 countries in the world that could take it out.
China.
So we talked about it, and they said, you'll have to take it out because we don't have the capability of doing it. So for those people that like to say that those great pilots in those great planes, well, we just ordered 22 more of them, new and improved, that those great pilots didn't do their job. They did their job. At 1 o'clock in the morning with no moon, no light, no nothing. Every single bomb hit its targets. And then, as you know, we shot some incredible things that nobody else has. Nobody has a military like we have. We shot the Tomahawks from a submarine 200 miles away, and that went on top of it. But every one of those, including the Tomahawks, every one of those weapons and shots hit perfectly. And they said to me, just to put it on the record, they said to me, there are only 2 countries in the entire world that could ever get that stuff out of there because we don't have the equipment and nobody else. They said China and the United States. So I just want to let you know, those pilots did an unbelievable job, very dangerous job at 1 o'clock in the morning. Think of it, no moon, no nothing. We had no light purposely. And every single one of those bombs were right down an air chute.
Sounds like Trump's
in a granite mountain that exploded. And they are unable to get it, even if they wanted to. But we're not going to take a chance. So that's part of the deal.
So, sir, you said
no moon, no light,
to allow
no stars.
Yeah. Well, they did 2 days ago. They didn't. Okay. They did 2 days ago. They said, you're going to have to take it. We were going to go with them. But they changed their mind because they didn't put it in the paper. So when they sent us this document that we waited 4 days for, that should have taken 10 minutes to do, look, very simple. We get that. They guarantee no nuclear weapons for a very long period of time and a couple of other minor things, but they just can't get there. So they agree with us, and then they take it back. But they said to us that it was so badly obliterated, it was the word they actually used. That was my original word. Then it got challenged by some of the fake news. And it wasn't challenged with any knowledge. It was just challenged like they were hoping that this wouldn't have been so successful. No, it was obliterated. We have the greatest military in the world. I built it largely in my first term, and I didn't know I'd be using it quite this much in my second term. But very simply, when they say, does he have a plan? Yeah, I have a plan. Plan is very simple. You know, in war, you have to change. You have to be flexible. You have a lot of plans, but you have to do different plans in different days. But I have a great plan. But the plan is that they cannot have a nuclear weapon. And they didn't say that in their letter.
Mr. President, given the leadership changes that you've talked about in Iran, is this still a leadership that you believe you can negotiate with and ultimately reach a peace
I think
deal
so. Well,
with?
you have two. You have the moderates and you have the lunatics. And I think the moderates are more respected. The lunatics want to fight till the end. You know, it'll be a very quick fight. But I call them. You have, just like our country, we have lunatics too. I call them lunatics. I call them stupid people too.
Stupid.
But in Iran, they have the
retarded.
moderates and dying to make a deal, and then you have the lunatics. And I guess they're a little bit afraid of the lunatics, but and why not? The level of ferocity for protest. You know, the people are watching it. They want to go out on the streets. They have no weapons. They have no guns. We thought the Kurds were going to give us weapons, but the Kurds disappointed us. The Kurds take. They have a great reputation in Congress. Congress says, oh, they fight so hard. No, they fight hard when they get paid. So I'm very disappointed in the Kurds, but they were given, I said it wasn't going to work, by the way. I just have to say it. I disagreed with what they did. They gave it. I said, they'll never get there. And I was right. I like to be right. In this case, too bad, but we sent some guns with ammunition, and they were supposed to be delivered, but they kept it. I said they're going to keep it, but what do I know? I've only been doing this a short period of time. What do I know?
Me and Trump and Daddy have something in common. I just heard him say it. We like to be right. So just wanted to interrupt this for a moment just to tell you guys that him and I, we share something in common. Like to be right. Hopefully no one has a problem with that. I mean, I know they don't have a problem with Trump, so they shouldn't have a problem with me wanting to be right. Just to be fair. All right.
What?
For the time being, the ceasefire remains in place?
It's unbelievably weak, I would say. I would call it the weakest right now. After reading that piece of garbage they sent us, I didn't even finish reading it. They said, I'm not going to waste my time reading it. I would say it's one of the weakest right now. It's on life support. They understand these are all medical people. And Dr. Oz, life support is not a good thing. Do you agree?
Bad prognostic.
I would say the ceasefire is on massive life support, where the doctor walks in and says, sir, your loved one has approximately a 1% chance of living. Yeah.
Mr. President.
Daniel, go ahead.
Yep.
One of the best reporters in Washington.
Thank
Go
you,
ahead.
sir. Dr. Oz referenced this a little early. 2 questions on healthcare, if I can. The Council of Economic Advisors released a report saying that the most favored nation drug deals will generate about $529 billion in domestic savings over the next 10 years across all markets. How transformative are these deals?
Makes people better.
Yeah, it does. How transformative are these deals for millions of Americans? And do you believe that the most favored nation drug deals are the Republicans' golden ticket to the midterms?
I think the Republicans should walk away with the midterms. Now, typically, whoever is president, they vote the other way. Nobody knows this. Do we have a psychiatrist in the group? Nobody knows what, because I think we've had the best president. A lot of people have said, even some radical left lunatics have said that we've had the best presidency, the best first year of any president. Look, I stopped 8 wars, got the largest tax cuts in history, the largest regulation cuts in history, all the things we've done, so many, like all of this that we've done, medically we've done so much. We did a thing called Right to Try in my first, and I could never understand it when I was a civilian, which wasn't so long ago. I haven't been doing it that long, but I always used to marvel at the fact that if they had a great drug and it had to go through the FDA, and the FDA guarded it and said, you can't use it. And if a person was terminally ill and the drug was showing great promise, the person's terminally ill, they wouldn't give it to the person because they didn't want to hurt the person. And I said, well, we need something of that. And it was very important to me. And I had no idea it would be so hard to get, but we got it in total. We got it in full. It's called Right to Try. That if you're terminally ill, you have the right to try a drug that has not gone even anywhere near final. If it shows even a little promise, and we've saved thousands of lives. It was very hard to get because the insurance companies didn't want it, the doctors didn't want it, because the doctors didn't want to be blamed. The drug companies didn't want it, because if it didn't work, they didn't want it on their record. So what we did is we said, we're not going to count it on your record. If somebody's terminally ill and they take the drug, it doesn't work, we're not going to count it on your record. We'll have another record, a little smaller one that not a lot of people look at, but we're not going to count it on your record. So Right to Try has been one of the great successes. Again, nobody talks about it. We've saved thousands of lives, but you know what is maybe even more important? We've learned very quickly that some drugs work and some drugs don't. In other words, some drugs take a person who's terminally ill, and there are numerous cases, and without waiting 7 years, 10 years, we by the way, we think we've cut it in half, but you do need a period of time. Without waiting many, many years, we know the drug works because we've taken people that were dead. We had a person given the last rites, God, the kids are crying, and started them on this drug, and the person became better. It works, and some don't work. But you learn really fast. It's called the ultimate test, I think, right? They test all these things. They use animals all over the place. They use everything to test. The person's going to die. So they didn't want it because they didn't want to be sued. The drug companies didn't want to be sued if it didn't work. The country didn't want to be sued. So I got everybody into a room and I said, we're going to do this, but if anybody uses it, they have to sign a document. They sign a very strong document that they're not going to sue the doctor. They're not going to sue the country. They're not going to sue the manufacturer, the pharmaceutical company. They're not going to sue anybody, but we're going to give it a shot. It has been, Right to Try has been so successful. It's been amazing. Nobody talks about it, but everyone knows how successful.
Mr. President, there was a young man that we visited on, actually in Los Angeles, who was taking advantage of this program. Katie actually spoke to him by phone. It's from Alabama. That he reached out to you directly, and this is the same program that benefited him. And just to put numbers on the Council of Economic Advisors, it's between 500 and whatever it was, 30 million that you said, and $700 billion in savings. So we estimate at $600 billion in total savings, and the impact on the American people, Mr. President, is 1 in 3 Americans leave a drugstore without their medication because they can't afford it. Even though they got a doctor's prescription, they know they can make a difference in their lives. That will no longer happen with the most favored nation drug pricing. And we're giving drugs like which, as you call it, the fat shot, the weight loss drugs to all beneficiaries of Medicare. Every senior in America can get them for $50 starting on July 1st. These are just inconceivably good prices, and they're so good, in fact, that we actually save the taxpayer money by reducing the downstream effects of obesity, diabetes, and hypertension. Mr. President, all possible because you took brave action. And again, the quick question we should be asking ourselves is why did this happen a decade ago? Katie, what do you think about that young man?
That he has a new lease on hope, and it's because of you. I talked to his parents, and they said, we feel so good about our country that we literally have the president and Dr. Oz and Secretary Kennedy doing everything possible to give our son a fighting chance. They said before, no one was listening, but you, Mr. President, took action. And Will Roberts, he is such a great young man.
Well, Right to Try is
so many people.
Nobody talks about
We're
it.
with him.
Thousands of people, but it's also like this incredible laboratory of people they're finished. They're terminally ill. They're not going to live. And we weren't given, and this went on for years. This went on, Madam Secretary, you're doing such a good job with prices, agriculture. How's the beef doing? We got to get the beef down.
We're working on it.
It's the only thing, we got to get the beef down. But
more affordable.
this was so incredible because, and I marveled at it for 30 years. I'd say, why? I'd have friends that were terminally ill. You'd meet people that were really in bad shape. They weren't going to make it. And they couldn't get a drug that looked like it was going to work. They couldn't get it. They asked me to get it. You have contacts. Could you get it?
I just now realized.
You go to jail if you get, and they're going to die. They died 3 weeks later, 4 weeks later. And we're saving a lot of people that were gone, that were terminally ill. And what we're doing is producing almost immediately. You can almost immediately approve these drugs. But it was very, look, legally it was a disaster because everybody would be sued. The problem is somebody would die and then they blame the drug and then the drug company gets sued, the doctors, the country gets sued. You know, a member of the family goes crazy and you're settling for millions of dollars because you killed somebody that was going to be dead in 2 weeks. So I did that and I'm very proud of it. The other thing, doctor mentioned the fat drug. So think of it, $87 it would sell in London and $1,300 in New York for the exact same box made, I won't name the company, made by the same company in the same facility. $87 in London, $87 in Heidelberg, $87 in Paris, $1,370 in New York. And this went on for a long time. And I want to say, you know, he could be a famous guy. He's begging me not to release his name.
Did he say the fat drug?
He's a very highly neurotic, very fat, sort of a fat slob, I would call him. But he's a brilliant man. We know many of those people. He's a brilliant guy, actually. But he said, President, what the hell's going on here? He didn't need the money. He's rich as hell. But he just couldn't understand why he had to pay so little in London. He went to London and he couldn't understand it. He said, this is crazy. And it actually motivated me in a certain way because he was very smart. He did a study. He actually sent his people and he traced this medicine and he found out it was the box here is the same box as he had in New York. It was made in the same plant and it cost, 10 times more here than it did in London. And that there are worse stories than that. And I said, that's it. It's over. We're going to do it. That got me really motivated. He's begging me not to release his name because he is a well-known person. And I've so destroyed his reputation in terms of his physicality that he just doesn't want to. I said, you've had a big impact on medicine because you got to be better than any normal person could have, He said, no, I don't want to. Okay, yeah, please.
But what do you hope to get out of the summit in China, and how much has the war in Iran changed the agenda?
Look, I have a great relationship with President Xi. We're doing a lot of business, but it's smart business. We used to be taken advantage of for years with our previous presidents, and now we're doing great with China. We make a lot of money with China. I have a great relationship with President Xi, and I think you can see that with the fact that in Hormuz, they get a big percentage, 40% of their oil from Hormuz. There's been no ships coming in, no nasty ships coming in that we end up in skirmishes with. He'd like to see it get done. He doesn't want to see, I'll tell you what, look, I respect him a lot. And hopefully he respects me. He didn't respect our previous government, that I can tell you. The guy couldn't talk. It was ridiculous how that ever happened. Our country was hurt so badly the last 4 years. I say it all the time. It was the king of Saudi Arabia, but everybody says we were a dead country a year and a half ago. And now we're the hottest country anywhere in the world. And you know that better than anybody. You see that. Olivia sees that. You see it in the numbers. Look at the numbers. Look at the stock market. The stock market is now higher than it was when this war started. So I thought that would go down 20, 25%. It was fine. I'm willing to say terrible expression, take a bullet. It's a terrible expression, especially when it's used by me. But I'm willing to take a bullet for the country. And I said, look, the stock market is going to go down, but we're going to have a threat of lunatics having a nuclear weapon. I deal with them. I say to them, I say, you people are crazy. I deal with them. They talk differently. I say, you're crazy. You're crazy people. You're nuts. You're not having a nuclear weapon. They think they can talk me into it, and they don't do very well with it. But they know how I feel. They can't have a nuclear weapon. They would use it within an hour after getting it. If the Obama deal wasn't terminated by me, they would have had it 6 years ago. And they would have used it immediately on Israel and also the rest of the Middle East. You saw that when they started shooting rockets. Nobody thought Saudi Arabia and Qatar and UAE were going to get hit, or Kuwait, Bahrain. I think it was a tremendous strategic mistake, and they wasted those missiles. We have the Patriots that knocked them down every time. I told the story. We have we were shot at, one of our great assets, happened to be a ship, great ship. 111 missiles going at very high rates of speed, sophisticated equipment. And, you know, that's all they did is build missiles, thousands of missiles. Who does this except for people that are looking for trouble? We had 111 shot at one of our ships over a very short period of time. Out of 111 missiles going at 3,000 miles an hour, all 111 missiles were knocked down into the ocean long prior to arriving at the target. And the coolest guys are the guys that do this. You know, they're not brawn, they're brain. They sit there, missile shot. You got to see it happening. Missiles coming. They got like about 13 seconds to make a decision. It's not like, gee, let's figure it out. They make a wrong calculation. You know, you lose a lot of men, and a lot of $1 billion times 10 ships. So, but there's a level of coolness that missile shot meant they'd look, ba, 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 and you know, they're going, heading 47 degrees north, 1,300 feet, going 3,000 miles an hour. Okay, we have it in our sight. Fire, boom. 10 seconds left. Let me tell you, they need smart people. These people are smart. And they're so smart that they're cool. You know, under the calculations, for some people are very tough. For other people, not so tough. There's, you know, about 1%. There's not too many. It's not too many people around like that. I say, a lot of times I'll call these gunners because they're phenomenal geniuses. You know, where did you go to school? I went to MIT. Where did you go to school? I went to the best schools. Smart. Got to be smart. We have the greatest military in the world. Okay.
Mr. President, back to motherhood. Your one big beautiful bill.
I like that. Because this is about motherhood, not about the beautiful country of Iran. Go ahead.
Yes, thank you all for being here. Your one big beautiful bill defunded Planned Parenthood for 1 year, but that expires on this July 4th. Would you like Congress to use reconciliation?
Well, we're going to see what happens. Congress is now negotiating. We've been very good for the people that want it, for the people that are here. And we'll see how that goes. It's been a very thorny, to put it mildly, it's been a very thorny issue. It's all under negotiation right now. Yes,
Would you like to see that defund?
Go ahead, please.
Thank you, Mr. President. What do you think about the handling of the hantavirus by the U.S.?
I think fine.
Do you regret withdrawing from the WHO? Given that?
No, I'm glad. So we were paying the World Health Organization $500 million a year. Look, it's a lot of money, but in the overall scope, it's not that much, but it's a lot of money. And we weren't being treated well, and they were making the wrong diagnoses. I was the one that said it came from Wuhan. They didn't say that. They refused to say that because they were totally owned by China. So I was saying it came from Wuhan. They didn't want to say that. Now it's turned out, I think it's been conclusive that it came from Wuhan. But I said that on the first day because I saw satellite pictures with body bags all over Wuhan, literally all over Wuhan. So I said that they lied to me or they didn't know. So we were paying for, let's say, 350 million people. We were paying $500 million a year to the World Health Organization. That's a lot of money. What the hell are they going to do with that kind of money? And China was paying $39 million a year for 1.4 billion people. So I said, you know, you got your story wrong because we should be paying about $10 million, not 500 million. And they were willing to negotiate, but it was so popular when I pulled out. They gave us all wrong information. On COVID, they were totally wrong. And I looked today and I saw the same doctor that was there. He's a good politician. I don't know how the hell he got this job, but he was there telling us about this. Now, the one thing with this one is that it's much harder to catch. And we've had it for a long, it's been around for a long time. People are very familiar with it. So, you know, I hope it's fine. All I can do is everything that a president can do, which is actually somewhat limited. But it seems like it is not easy to spread. In fact, it's in certain ways very hard to spread. We've lived with it for years, many years, And we think we're in very good shape. We're very careful. And Nebraska has done a fantastic job. They have a place there that those doctors are unbelievable. The job they've done.
I already said that. Trump already said that for you. They're unbelievable.
Yeah, I'm going to reduce until let me tell you, as soon as this is over with Iran, as soon as it's over, you're going to see gasoline and oil drop like a rock. Going to be dropping down like a rock. I mean, already, look, just on the basis of, things have happened. When it first came about, 20% of the oil came out of Hormuz. That's a lot. But, with time, it's like they go into Texas, they go into Louisiana, they go into Alaska, a lot of Alaska. Alaska's, sort of, it seems like very far away from Asia, but it's actually a relatively short trip by comparison to other locations they have to go to get oil. And they go into Alaska. In fact, our big problem is we're building bigger docking to fill up. But we've become very big on the filling station. We're a big filling station. And what's happening is when people heard about losing Hormuz, they said, it's genius. They're finding other locations. And some of those people, I spoke to them, companies and countries, some of those people are going to continue to go to Texas. They like it better. They said it's an extra 45 minutes. They like it better. And it's sort of amazing, it found its way. So a lot of people thought oil would go to $250, $300. It's not. I mean, today it's at less than 100. Think of that. Now, when this ends, you're going to see it drop like a rock.
How long are you going to suspend that tax for then?
Till it's appropriate, yeah. It's a small percentage, but it's still money.
Mr. President, do you still believe a diplomatic solution is possible with Iran, or do you only have military options left?
No, I think it's very possible. Look, I've had to deal with them 4 or 5 times. They change their mind. They're very dishonorable people. The leadership.
What?
Don't forget it's the 3rd level. The 1st level is gone. They were unreasonable. The 2nd level was more reasonable. The 3rd level, nobody wants to be president, They say, who wants to be president? There's nobody raises their hand, But
you want to be president, pink or pink?
They change their mind. I've had that in business many times. The mind changes, you call them.
Nope.
These people that you make a deal and then the next day they send you a document that takes 5 days to get there when it should have been there in 20 minutes. It's a pretty simple document. They will never have a nuclear weapon,
Thank you, sir. I was speaking with Claire Lai this morning. She's the daughter of Jimmy Lai, and she told me that she's been praying and hoping that you'll be the one that brings her dad home. She says of any administration, she thinks you're the one that could do it. Do you think
said
you
Jimmy
can?
Lai.
Jimmy Lai's daughter.
And there's another gentleman, a minister, pastor, as you know. I'll bring them both up. I brought it up before. Jimmy Lai, I brought up. The other one I just heard about this morning, actually. And I do bring that up. We've gotten, I don't know if you've been reading, John Cole, who's a great lawyer. He was a tobacco lawyer. Great guy. I won't say he's an older guy because he may be offended by that, but he is. He's a little older. And he's a wise man, actually. He made a fortune with the tobacco. He did the first tobacco lawsuit. And he's a great man. And he's brought back hundreds of people out of various Belarus. You read about that. We had
I'm not running for
leaders
president.
been fantastic. But somebody has to ask him. Biden never asked. We asked. And we're getting hundreds of people out of confinement and prisons that shouldn't be there. And hundreds. And many of them aren't even citizens of the United States. They're people that have been captured in some form, ministers, people that are really innocent people, and they're being held captive. And I bring up Jimmy Lai. Now, Jimmy Lai, he caused a lot of bedlam. I don't know. It's like saying to me, if Comey ever went to jail, would you let him out? It might be a hard one for me. Does that make sense? It might be a hard one, because he's a dirty cop. But Jimmy Lai isn't that way. But Jimmy Lai, he caused lots of turmoil for China. He tried to do the right thing. He wasn't successful, went to jail, and people would like him out, and I'd like to see him get out too. So I'll bring him up again. I have brought him up. There's another gentleman, a pastor, as you know, with a beautiful daughter and son-in-law that would like to see him get out. I'm going to bring his name up.
Mr. President, what about Taiwan? Do you expect Taiwan to come up in your?
Yeah, it always comes up. It always comes up. It's. I used to say Ukraine would. 4 years you never even heard the word Ukraine. It was never going to happen, and it was handled so badly. Ukraine should have never come up. They lost last month 25,000 soldiers, both sides. 25,000. They're losing on average 25,000 soldiers. It's like a meat grinder. It's horrible what's happening. That would have never happened had the election not been rigged. That would have never happened. And Putin and I would talk about it, but there was never any, he would have never done it. Taiwan, I equated a little bit to that. If you have the right president, I don't think it'll happen. I think we'll be fine. I have a very good relationship with President Xi. He knows I don't want that to happen. Very far away, very, very far away. We're just at 9,500 miles. We're 9,500 miles. He's 67 miles. It's a little bit of a difference, but there's a lot of support for Taiwan from Japan and from countries from that area.
Do you think we should still be selling them weapons? The United States should.
Well, I'm going to have that discussion with President Xi. President Xi would like us not to, and I'll have that discussion. That's one of the many things I'll be talking about. We'll have he and I have gotten along well, other than with COVID. I was not. I was just not accepting of what happened with COVID. But other than that, he and I have had. He's a great gentleman. I find him to be an amazing man.
Yeah.
And when I say that, the press always says, "Oh, that's terrible that he told him." He runs 1.4 billion people.
And the guy next to her has been nothing the whole time.
He's
his feet are tired.
He loves his country. I can tell you that. President Xi. I look forward to being there. And if he felt anything, we wouldn't be doing it.
Why is he taking an hour for this?
A lot of good things can happen. Now, we'll be talking about, he'll bring up Taiwan.
Frozen in time.
I think more than I will. But I think that a discussion will be a little bit about energy and about the very beautiful country of Iran.
She's going to be mad.
And by the way, Iran is a beautiful country, but it's got people running it now that shouldn't be there, perhaps. Yeah.
Mr. President, just a couple questions. Outside of these amazing benefits from employers for IVF, there are a lot of women out there who either they work part-time or they self-pay for health insurance. Is there an option for cheaper IVF for those women?
And what would you like to know?
For IVF, bring it down to the cost that's associated.
I don't know. Olivia, could you answer that question?
We're trying to make.
Putting her through a little training here, Tom. Let's see whether or not she's got it. I have no doubt she does.
Just a softball from the president. A healthy moms, healthy babies, America.
Let's give this one to Olivia.
We are focused on making America the safest and best place to have a baby. The IVF question, I think, could probably be better hit by Senator Britt and Dr. Fink and others.
Yeah, so what we're trying to do is obviously make sure that people have greater access and affordability goes down. We did that obviously with what you saw from the president last year and the two different announcements he made. We've seen, over thousands of people have more access with regards to affordability. I think we've saved about $15 million, but we know that this is going to go up to the tunes of billions of dollars with what we're doing here. With being able to allow employers to do this, we think it will ultimately drive down to each and every person. So that is the point. The more that people are able, we want to get, as Secretary Kennedy said, we want to get to root causes as well. So we want to make sure that we are treating the entire issue, not just putting a Band-Aid on it and moving on. We want people who want to bring life into the world to have that opportunity. We do believe that this will do that. So a combination of allowing this to be available, but then also the affordability element. I think it's down, as he said, some of these drugs down 80% from a year ago, some down 40% over a year ago. So it's a really exciting time, and we do think that this will ultimately be able to reach all Americans.
But a lot of people don't realize it's available. I spoke to people, they don't know about the Trump, they don't know about any of these things that, where you're saving so much money, where they can actually afford it. When you get prices down to just a tiny fraction of what they used to be. That's one of the reasons I don't need it for myself. I get enough publicity, but I need it to inform the public. A lot of people, like your question's a good question, but a lot of people don't know IVF and so many other things that could help them, that they assume it's so expensive, it's not within their price range, and they're not going to be able to afford it or even think about it. And then they hear about these numbers, and in addition, there's some help that we give them beyond even the low numbers.
Mr. President, only 1 in 3 Americans know what TrumpRx.gov does. It would be a great service. I know he kids you a lot about this not getting reported on appropriately, but there is no excuse to buy drug in America and not check TrumpRx.gov just to make sure you're getting the best price. So think of it as a transparency site. And sir, we've got tens of millions of people who are going to it, but there's hundreds of millions of Americans. So we have got to get Americans to realize, you mentioned fertility. If fertility drugs are probably a third of the cost of the entire process, for those to drop by 90% dramatically changes the equation. And they're private companies who are now taking advantage of the whole group of individuals who can get access to fertility medications and the treatments that go with them. And as the services get better, we make them more affordable, we'll have more Trump babies.
Yeah, and we hope that that lays the groundwork there so that anyone has the ability to receive these. And also remember, this is all on moms.gov as well. I mean, that's one thing we're trying to do is make sure that
Moms.gov.
to all of these resources, because when you either want to have a child or you find out you have a child, sometimes it's a very exciting thing. Sometimes, you're a little overwhelmed. We want all of those resources to be in one spot so that we can help these women in their journey to motherhood.
And when people hear how inexpensive it is relative, they can't even think about it. Now all of a sudden they say, I can afford that. And they get help also in affording it. There are ways of getting help to
The girl next to
afford
her is
even
like,
those low prices.
I'm mad.
How about one more last question, please?
Thank you, Mr. President. What do you say to infectious diseases experts who say they're worried the country may not be prepared to deal with something like hantavirus because of all the HHS, funding and staffing cuts?
Well, I think we take care of that. Do you want to answer that?
It's just not true. Jay Bhattacharya has taken this task on. Secretary Kennedy is involved with them. You can speak to perhaps even better than, frankly, best in the room. But the country is prepared and the CDC is focused on it. And the agency is well aware of the opportunities to actually treat this problem, not just try to prevent it in the future, but treat it if it happens now. Secretary?
Yeah, I mean, we've had CDC teams on it from day one.
He's back.
I was speaking with the University of Nebraska since the second day of the outbreak. I was speaking with Governor
Yes, it does,
of Nebraska. We had a CDC team at Tenerife. We had airplanes ready to take the patients, the 17 patients, off the vessel and transport. 2 of them went to Atlanta. One of those was symptomatic. They're in a biocontainment lab in Atlanta. The other 16 are now in Nebraska. One of them is symptomatic. He is in the biocontainment lab. The other ones are being tested and supervised and given plans for going home. We have this under control and we're not worried about it.
But the CDC took 4 days after the WHO issued its, alert. Why was it? Why did it take the US 4 days to issue an alert?
It's not true. As soon as we determined that the virus was out there, we issued an alert.
Which way she turns
Your
her
word
head.
means nothing.
They
It's all
acted very
the-
quickly. I saw the alert too. Give me a
Those
break. They acted
reports
very,
were
very quickly. And it looks like, and can't bet anybody's life on it, but it looks like it's just a disease that we've had around in a very
I was thinking
small way for a long
simply.
time. Not a
I
good
was
one to
thinking it
catch.
the whole
'cause,
time since I heard it.
It's a very severe disease if you catch it, but it's very hard to catch. Daniel, did you have a question?
One last one. Senator Burt mentioned the website moms.gov. One of the policies that's on there
Right.
are the Trump accounts, right? They're getting ready to go live this summer. When you speak to young parents, this is one of the policies they repeatedly bring up about how impactful it will be for them. Can you just talk about why Americans need to know about this and how important it is for younger parents to give their kids a head
So
start?
we've done more for young parents. I guess it's the way you could say it. It's a great, beautiful term. But we've done more for young parents than any administration ever in
I like to be
history.
right
And,
sometimes.
we're going to continue to do so. This is, look at the people up here. They're all like brilliant. I'm one of the young ones, I'm a similar age to all of you. Very similar. I feel the same as them. I actually feel more sure. I don't know what this is. I feel the same as I did 50 years ago. Yeah. It's crazy. Someday there'll be a day when that won't happen. I'll let Bobby and Oz know, you know? It's not quite the same, but I feel literally the same. I don't know why. It's not because I eat the best foods. Maybe they are the best foods. Who knows what the best foods are? Maybe junk food is good and the other food is no good. I know people.
I agree, kind of.
That eat the
Yes.
best food. They go to a restaurant. They have celery, and I don't want. And I'll have steak and everything else. And
he's like me.
I say, "How you doing?" Well, it's over for me at a young age. Right? And all they do is watch it. I know many, many people that all they do is watch their weight, their this, their that, and they kick the bucket. And here we are. I feel great. Thank you, Daniel. Thank you very much, everybody. Have a good time.
All right.
Pulitzer Prize. Pulitzer Prize.
Thank you,
Thank you, Press.
Thank you, guys.
Look at all the blondies.
Thank you, guys.
He likes his blondies. Trump be liking his blondies. That's for sure. We know that. Trump likes his blondies. That's a fact. Clear the room, Press. Come on, Press. Get out. It's been an hour and 15 minutes. Nobody is having children because our country is all effed up. Well, people are still having children. But I get it. A lot of people think before they have kids. Children. Excuse me. I don't say kids. I say children. Clear the room. Yep, that's what they were doing. Clearing the room. Moms.gov. That's a horrible name. That's a horrible name. Who came up with that one? He's getting ready to be live again. I'm not doing it. I got to try to do some other stuff. Thanks. Ooh, Seaside looks beautiful. Is that right now? Oh, sorry. Seaside. Look at that. That's beautiful right now. That's yes. That's our one of our beaches. That's one of our beaches. They got a cool arcade there. Actually, there's a cooler one in Lincoln City. There's a cooler arcade in Lincoln City than there is at Seaside. Yep. They got bumper cars, Tilt-A-Whirl, and putt golf. That's beautiful. Mm-hmm. Mm-hmm. Yepers. What's he going? It's for a football team that went there. What team is it? He's just coming out now. I don't know. Indiana, Hoosiers, whatever. Football team. He's doing a thing. All he's going to do is talk about the same stuff. He's just going to say the same stuff, what he's doing. That's all he's going to say. Thank you for coming. He's going to congratulate them for like 3 minutes, and then the rest of the 20 minutes, he's going to talk about what he's doing. That's honestly what he's going to do. I kid you not. I promise you. Come on, you guys should know Trump after 8 years. There's nothing new. There's never a speech that's new. Ever. Ever, ever. Ever, ever? Ever, ever. What's going on? Forever, ever, ever, ever. Fernando Mendoza? Who's Fernando? Who's Fernando? Oh, he's talking. You can't even see him. Everybody's standing up. I don't want to play it. Brr. You guys are gonna make me play it, aren't you? I can tell. He should just restream himself talking. He should. I'm just saying. That's what he does. He just talks about himself. What his accomplishments. Goodness gracious. All right. Whatever.
And I want to say that
Here we go. I want to say, here's what I
right
do.
over here. He likes Indiana. We won Indiana by a lot. It always helps when you win it by a lot. I think we won them all by a lot. You want to know the truth, but they just forgot to put that down. But we won by a lot. We just had a big victory. We beat 7 out of 8
he
candidates that were
inserts
running against
himself
Trump.
in.
That was good. And the only reason we lost the other one is there are 2 people running. They split up that vote. I can't believe it.
Oh, he's talking about voting.
But we're joined today by Vice President J.D. Vance. He's fantastic. J.D., stand up for a second, will you?
Just stand up for a second, JD.
And his sons, Ewan and Vivek, as well as Secretary of the Interior, Doug Burgum.
Burgum.
Great secretary. We're doing now the reflective pond, and we saved about $600 million or something. It's going to be beautiful. It'll open about 2 weeks, and it's going to be incredible. They've been trying to get it open for years. They had no idea what they were doing, but we know how to do it, Doug. And it took us 2 weeks versus the projected 4 years. People would not understand it, but you're doing a fantastic job. Secretary of Agriculture, Brooke Rollins. Brooke, thank you.
What?
Get those prices down. They're coming down. I see prices. We inherited the worst inflation in history. She's getting the prices down big. Thanks, Brooke. Secretary of Commerce, Howard Lutnick, doing a wonderful job. Thank you, Howard. Acting Secretary of Labor, Keith Sonderling. Thank you, Keith. Good job. Secretary of Energy, Chris Wright, supposed to be the best in the business. Well, you know what? I figured it would triple when we did. We had to make an excursion to the beautiful country of Iran. We didn't want to let them have a nuclear weapon. And we made the right decision, and we've got it pretty good. And those prices are going to come crashing down as soon as that's over. And we'll get taken care of. We got to take care of business. Great job. You're doing a great job. Thank you, Chris. HUD Secretary Scott Turner, former NFL player, by the way. A great guy. U.S. Trade Representative Jamison Greer, one of the most important men anywhere in the world. We need more tariffs, Jamison. We need more tariffs.
That's bogus.
And SBA Administrator, who's fantastic, Kelly Loeffler. Thank you, Kelly.
Fernando, that's
And I
bogus.
see Kevin over there. I don't know if they have your name now, Jeff. Will you stand up? You were so good on television over the weekend. Thank you. Kevin Hassett. Thank you, Kevin. Thanks also to Senators Todd Young. Where's Todd? Thank you. Thank you, Todd. You have a great group of people. What a group. This is a big day for Todd and Jim Banks. Jim, stand up. Where are you? Senator Banks, my friend for a long time. And Representatives Marlon Stutzman, Jim Baird, Rudy Yakim, Aaron Houchin, and Nick Begich. Thank you all. Warriors. We also have Mark Mesmer, Jefferson Shreve, and Victoria Sparts. Hi, Victoria. Victoria Sparts. She's been very good. On occasion, she gets a little bit bad, a little nasty. But she is good, and she's smart, and she's always with us, right? Thank you, Victoria. Appreciate it.
Thank you, Victoria.
Also with us is Speaker of the Indiana House, Todd Hudson. Thank you, Todd.
Thanks, Todd.
Thank you, Todd. You guys have been great. Indiana Senate Majority Floor Leader, Chris Garton. These are all people that were with me, right, Chris? We don't have any of those insurgents, do we? We had a big, they don't know what I'm talking about behind me because they're into football, but we had a little insurgency in Indiana that didn't last very long. We had what a great group of people we had. We have many of the Republican patriots from the great state of Indiana, including Trevor DeVries, Brian Schmutzler, Blake Fichter, Tracy Powell, Jeff Ellington, Michelle Davis, who last week had a big primary election. They've all told, are you the people? I love you people. That was carried all over the world. They ran against people that were there for 20, 25 years, and they were, let's see, I'd say young, certainly young, but they were not expected to win. They were down by 25 or 30 points. We endorsed them, and they won in a landslide. Thank you very much. Congratulations. You'll be there a long time. Thank you very much. That was a story heard round the political world, wasn't it, huh? Wow. That's so nice that you're here. Actually, they're my favorite people right now in the audience. I don't care about that, Jim Banks. They're my favorite people, right? We're also joined by the great Sage Steele, who's a fantastic person and a supporter and a friend of mine. Thank you. Thank you. And former NFL quarterback Trent Green, great quarterback. Where's Trent? Hi, Trent. Great job. That's a good quarterback. This was a year that will live forever in the hearts of Indiana football fans. It was an exciting year for football, but maybe you're the biggest story. I think, Coach, you're the biggest story. There's no story like this. The Hoosiers delivered the program's first ever undefeated, untied season and capped it off with their first ever national title. That's amazing. The National Signing Day, think of this, the press conference in 2023, shortly after joining Indiana. Who's Kurt? Kurt Signetti. Where is Kurt Signetti? Huh? Oh, come here. Come here. Kurt Signetti has turned out to be, I think he's the coach of the last decade, because he took a team. Nobody knew him. Nobody knew the team. And he ended up taking this team all the way. People were betting against you all the way, Kurt. He took over in 2023 following a really bleak 3-9 season and immediately set a tone that few people have seen, I think, in the history of college football. At the National Signing Day press conference in 2023, shortly after joining Indiana, Kurt was asked how he communicates his vision to recruits. And he said, it's pretty simple. I win. I just know how to win. That's a very cocky guy. I don't like people like that. Nah. I like this guy. Just 2 years later, he brought home the national championship. So, when you do that stuff, you have to be able to produce when you act that way. Muhammad Ali used to get up there and, over the years, I've seen people that did it better than Muhammad Ali. The problem is they couldn't fight properly. They lost. You can't do that and lose, right? But very special coach, I'll tell you that. I just got to know him a little bit backstage, and he's a winner. Every player in this team shared their coach's winning mindset, and they executed with unbelievable skill. They're skilled people. This season was also historic because starting quarterback Fernando Mendoza. Now, the reason he's not here, he was so nice he called, because he has actually, JD's a big fan of ours. You wouldn't believe it, because he didn't show up. I'm not happy, but that's okay. The reason he didn't, because he's at spring training, right? Correct. And I actually said, you really let him, he's got to win. And I think he's going to win pretty early, Coach, right? You think pretty good? Well, time will tell. He's going to be a good one. A lot of people said they're going to win, but I think he will. No, he's been great. And he's at spring training, like his first day or something. I said, you better go there. But he became Indiana's first. Otherwise, if I didn't do that, I believe me, I wouldn't have even talked about him. I would have not, if he was not here for other reasons, like he didn't like Trump or he didn't want to come, I wouldn't have even mentioned him. I'd go through the whole, I'd talk about how great, I wouldn't even mention the quarterback's name. But he's a great guy, actually, and he is actually a big fan of what we're doing for our country. But he became Indiana's first ever Heisman Trophy winner, right, Coach? And Fernando completed 226 of 316 passes. That's good. Throwing for 2,980 yards. Let's round it off for 3,000. Okay, I'm going to round that off a little bit, Coach. 3,000 yards and a nation-leading 33 touchdowns. Fernando couldn't be here today because, as I said, he's now a member of the Las Vegas Raiders. And let's see how good a team they have. And I think he's going to do great. He's a winner. With Fernando's help and a stacked lineup, Indiana utterly dominated in the regular season, winning 10 out of 12 games by double-digit margins. In the first 3 games, Indiana outscored their opponents, 156-23. I think they have a good coach. And they closed the regular season by crushing their in-state rival Purdue, always a good team, 56-3. That's pretty good. Nice memories. Huh? But things weren't as straightforward in the Big Ten championship against Ohio State. That was a tough one. Indiana entered the game known for its rock-solid defense and actually known for college basketball, to be honest with you. And now I think they're going to be known for football. But they entered the game against Ohio State, and people really, I think they thought of Ohio State as being almost unbeatable and brought back one of the most explosive offenses in the nation, Ohio State did. But in the end, the Hoosiers prevailed over the Buckeyes. Junior linebacker Isaiah Jones. Where's Isaiah? He can play. I said, how good is he, Coach? He said, he can play. Let me see. He's a good-looking guy. I don't like good-looking people. I don't like good-looking men at all, believe me. But he recorded 2 of Indiana's first 5 sacks. Think of that. So he had 5 sacks. Well, helping the team secure a hard-fought 13-10 victory, really against a great football power. Right? That's a big honor. Next up was the Rose Bowl, where Indiana delivered a commanding 38-3 victory over Alabama. Coach,
no time.
You got to be kidding. That's right, over Alabama. That's a big one. After a scoreless first quarter, the Hoosiers broke through and never looked back. Defeating the Crimson Tide is no small feat, and it wouldn't have been possible without starting center Pat Coogan. Where's Pat? Oh, he's at training camp. Forget this. Forget training camp. But he's a good fan, Coach, right?
Absolutely.
Okay, good. I'm glad I mentioned his name. That's good. Say hello to him. That's a big deal. In recognition of his dominant performance, Pat became the first offensive lineman since 1944 to be named the Rose Bowl's most valuable player. Pat is busy today in training camp. That's great. Is he that good?
Oh, yeah.
Is Pat Coogan that good?
Seriously good. We got 15 of them in training camp.
Wow,
right now.
is that right?
Yeah.
Wow. 15 in training camp. Wow. How many potentials do you have back there? A lot, right? Quite a few potentials. In the Peach Bowl, Indiana shattered Oregon's confidence. That was another one. Oregon was supposed to be a hot team. I watched it. I said, what's going on here? But they shattered Oregon's confidence right out of the gate when, during the first play of the game, cornerback D'Angelo Pons, what a good name, intercepted the ball. Where's D'Angelo?
Training camp.
Oh, I can't believe it. No wonder you won.
He was a junior.
Wow. How good? Really good?
Really good.
Intercepted the ball, ran it back for the game's first touchdown after securing a commanding 56-22 victory. This team was off to the championship. In the championship game against Miami, Indiana held a narrow 10-0 lead at halftime, controlling the pace but unable to pull away. The score remained low for most of the game, but everything changed in the fourth quarter. That's true. With under 10 minutes remaining, Indiana faced a critical 4th and 5. No coach in America would have done what this guy just said. This guy is making such a mistake, and he won. That was a hell of a play. You know, that's the kind of play. If they don't do that play, if it doesn't work, that's like career threatening, right?
Got to play to win.
You got to play. It was great. On Miami's 13-yard line, Fernando took the snap and powered through the defense past the first down marker before launching himself into the end zone, extending Indiana's lead 24-14. But Miami wasn't done yet. The Hurricanes took possession and scored, cutting Indiana's lead 24-21. Indiana got the ball once more and put 3 more points on the board, pushing the score to 27-21. I mean, you have to see this game. I would say that coach, I know he's got a good reputation. This guy is calling the wrong plays, but he kept winning. They kept scoring. They kept doing all this stuff. The things that weren't supposed to happen. You're just lucky you won that game, because if you didn't, they would have said, this coach is crazy. With just 51, that's why he's a great coach. With just 51 seconds left to tie the game and deep within Indiana's territory, Miami's quarterback fired off a 30-yard pass, only to be intercepted by junior Jamari Sharp. Where's Jamari? Jamari. Come on up. Come on. Look at this guy. You want to say? So go ahead. Tell him how good the coach is.
Coach Siggs is a very good coach, you know. Once he first came to Indiana, I didn't know if I was going to stay, but I stayed, and I'm glad I stayed because we won a national championship.
He doesn't want to leave the stage. Good-looking guy, huh? Thank you. He didn't want to leave the stage.
He didn't want to leave the stage.
He's a natural. So the Hurricanes are great. The team is so great. Jamari, I want to thank you for getting up and making such a rousing speech. By the way, a lot of people don't do that. You know, a lot of times they'll do that and say, no, I don't want to talk. But he's got a future in a lot of things, probably football. First of all, from there, the outcome was sealed and the Hoosiers became national champions. Think of that, right? I was there.
That's kind of cool, though. That is cool.
You went through a lot of great teams when you think, and real football powerhouses over the years.
The president of the United States put you on spot.
Yeah, amazing. Top tens. This team lifted the Indiana football program from a historic low. It really didn't have a good reputation over there, but tells you what coaching means too. But your grit and discipline and your belief and your strength of character, the coach is, I think he's just incredible. I think it's an incredible story. When I heard they were coming today, I said, I got to meet that coach, because he came out of like high school, a great high school program, but you made it good. But what you did is something that I don't think anybody's ever really done in college football history. How is your team going to be this year, Coach? What do you think?
Well, we got a chance if we commit, and if we have discipline and a great work ethic, and if we can handle success and we can handle failure, and we're consistent day in, day out, we might have a chance.
How about this guy? Is he central casting or what? I gotta watch you. I'm gonna watch you. You're amazing. You have made the fans really proud and inspired millions, all of you, the coach and the players, and reminded everyone that with determination and lots of hard work, anything's possible. And I said to the coach, you know, we have a very special area. Well, that's very special. We're building a beautiful ballroom. You can see it's not too small, Coach. We need it. For 150 years, they've wanted a ballroom. We're going to give them the greatest ballroom anywhere in the country. I'm very good at ballrooms. I'm very good at building things. But I said to the coach, there's a special place here, and it's called the Oval Office. Everything sort of begins, ends, and re-begins again. And I said, if you like, Coach, I'll take your entire team back, and we're going to go to the Oval Office, show him the Oval Office, and we're going to give him a very, very special medal. And I said, so what do you want to do, Coach? He said, we want to go. Hold it. You guys want to go to the Oval Office? Yes, sir. I had a feeling they would say that. I had a feeling. So, Coach, say a few words. You know, I'm really honored to be with this guy, because he took something from, it's not like he inherited a great program. He inherited something that was less than great, and he made it into something that probably has never been done at this level, never been done before. Congratulations, Coach.
Thank you. Got a lot of Hoosiers in the stands here and behind me. We got to give them one, two, three, Hoosiers, right? 1, 2, 3, Hoosiers. Okay, thank you. That's a lot of nice accolades there. Appreciate all that. It all starts with Pam Whitten, our president, Scott Dolson, our athletic director. You got to have a commitment at the top. Without a commitment at the top, nothing's possible. Okay. 2025 Indiana Hoosiers. All right. You know, 24 was a fluke, right? College football playoffs start out 10-0. You know, they won't be very good. All right. 16-0. That's the best record in college football since 1894. That's 132 years. That's before the NCAA. So safe to say that's the greatest record in college football history. Beat 6 top 10 teams, all right? And how did we get that done? All right, we had great people on the staff that thought alike, in the locker room that thought alike, great leadership, good talent, great character, coachable, 11 guys doing their job, play in, play out, all right? The sum becomes greater than, the whole becomes greater than the sum of its parts, and the most consistent, day in, day out, meeting in, meeting out, practice in, practice out, group I've ever seen in my life. And when, to me, it's a simple message, all right? Prepare the right way every single day to a high standard, and anything is possible in life. The only limitations are those between your ears, and you can't have any of those either. So go IU. Now, it's my pleasure to introduce junior wide receiver Charlie Becker from Nashville, Tennessee, or as Gus Johnson would say, Charlie B from Nashville, Tennessee.
How's it going, everybody? First of all, I just would like to thank Mr. President. Thank you so much for having us. This is an honor. I know I speak behalf of my team by saying we're going to remember this for the rest of our lives. And secondly, I would just like to thank all the Hoosier fans out there. You know, from the start of the season to the end of the season, y'all were there through the highs and the lows, and none of this is possible without y'all. So thank you guys, and go IU.
All right, and our appreciation for this great visit today. For President Trump, we have some Hoosier gear, which a couple of years ago they were giving away. Now you got to pay a lot of money for this stuff. So really appreciate this great opportunity and this great day. Thank you very much.
Thank you very much.
There you go, 46 on the back. I think we got one picture with, yeah.
I like this guy. That's great, Coach. Thank you. What else do you have over there? How about a helmet?
What else do you have?
We got a signed football, 16-0, fast, physical, relentless, go IU,
Wow.
Kurt Signetti, and players.
That's great, Kurt. That's great. Great, Kurt. We're coming down to the
We just got an IU helmet also.
Thank you.
No, we'll let you keep the trophy for an NIL contribution.
I'll do that for NIL. Boy, oh boy, did the courts screw us up, huh? That's all right. It's whatever happened. It seems to be working for you, and you're gonna make it very successful. You're gonna create something very, very successful. I have no doubt. So we're gonna take the players now to the Oval Office, and they're gonna get a little glimpse at some. I think it's the most important piece of real estate anywhere in the world in terms of
That'd be cool.
victory and in terms of winning and in terms of things that are happening. Things are happening right now. Our country, you know,
Oh, here we go.
a little bit like your team.
Couldn't
Our
stop it.
country,
Stop
a year
it.
and a half ago was laughed at. We were mocked. And now we're the hottest country anywhere in the world. There's nobody close. We're the greatest military in the world. We're unparalleled. And we're doing a job. We've made America great again. And this team has got a tremendous future. Don't lose the coach. She said, we can't lose the coach. It's a piece of work, right? We're not going to lose him. But I just want to thank everybody. It's a great turnout. It's a great turnout. But We do this a lot, and there's always spirit for a winning team. We have all the teams come here, but this was one I really look forward to because the story of Indiana University is really a legendary story. It's a very unusual story. We have a lot of teams where they win and they keep winning and they keep winning. They don't know what it is. And you have some that lose and get a little bit lucky. This is a team that came out from really a program that was a basketball program largely, and now it's a great, great football program. And you're going to have a tremendous year. It's a fantastic group, and I look forward to watching. It's going to be a very interesting, but you're going to have a great year. And I know people like this. There are very few of them. Never bet against a guy like this, I'm telling you. Never bet against a guy like Kurt. So thank you, Kurt and Coach, very much. Okay.
If people hated me as much
Thank
as
you,
they hate
everybody.
you,
We're
I'd
going to
brag
take
as
him to
much.
the Oval Office. Thank you. Let's go, fellas.
Ain't nobody hating Trump. Except the left, maybe. Left don't like Trump. The left don't like Trump. Ain't nobody else hating Trump. Nobody hating Trump. Ain't nobody hating Trump. Hey, you know what? Here, people hate me. So what? So what? I know Puff Daddy's Puff Daddy, but as he once said, ain't nobody gonna hold me down. I what? Mm-hmm. Who cares? Who cares if they hate? See, it's bad if you let it affect you. It's bad when you let it affect you, and then you got to talk about yourself. Who cares? Do your stuff. Let your. You know what I learned? For us, for people who are artistic, and I was always this way when I DJ'd. Like if I had bad days or things were getting to me, I let my hands and my craft speak for itself. Always let what you do speak for yourself when it comes to haters or anything else. Whatever you do, let your work speak for itself. Who cares if they hate? Trump should know that. As a businessman, he should, in my opinion, he should know that. Who cares if they hate? Let them hate. Let them talk. Don't hate him. Just don't like him. He is too prideful and boastful, like something out the Bible. He can have pride, but pride is a human thing, though. But I get it. I get it. I wouldn't care if I was him. I just wouldn't care. I'd be like, whatever. I got something on my shoulder. Get that junk off. Dirt off my shoulder. Who cares? I got folks all the time on X. Particular things and folks and things. Who cares? Whatever. Because guess what? It only stays hot for like 2 days. It's like 2 days. It stays hot. Moves on. And plus, and here's the thing. Honestly, with Trump, he don't see what they say. He doesn't see what people say. What the world is saying, what media is saying, what people are saying online, he don't see it. He does not see it. I bet Era would get that off. Yeah, we're gonna look at some Era. I told y'all there's a family store. I want to go check. I want to live stream it and go in there and check. I want to go check. I'm glad Trump has respect for sports. It teaches young kids to enjoy the process. Nothing ever. Yes, it does. Yep. Yep. It do. So I am. What time is it? I can go do some stuff. All right, and then I might be back on later. There's a debate. I don't know. They're kind of cool, but this one is a where's that? Where'd it go? It's a feminism on trial. I don't know. The right corner versus male feminist Brian. Another guy type of feminist sort of debate thing. I don't know. Oh, no? Nappy Roots? We'll see. We'll see. If not, maybe I'll dash. Either way, I'll be back on. Either way, I'll be back on at some point. So for as of right now, I'm going to get off and do some stuff. All right, y'all. Okay. Peace out. I'll see you guys later.
Yeah. On American streets. Yeah.
On American streets.
Yeah. Yeah. On American streets. On American streets.
Truth in the light, yeah, the whole world see. Faith run deep, where brave stand free. From quiet prayer to the place we meet. Quincy Franklin, bring truth on American streets. BCP preachers still spinning them beats. From DJ days now preaching in the streets. Fight for God and the freedom we keep. Still stand strong on American streets. Truth, truth, let the truth ring out. Hey, faith, that's what we about. See both sides, but we stand on truth. Call this nation back to its roots.
At his father's knee, where the roots run deep.
Freedom riders stood tall in the heat.
Now the same fire in his heartbeat.
Carry that truth on American streets. In DC downs with the Texas heat. Minnesota cold, the Oregon trees. Live in the streets where the people meet. All nationwide on American streets. Truth, truth, let the truth ring out. Faith, faith, that's what we about. See both sides, but we stand on truth. Call this nation back to its roots. On American streets. On American streets. Thankful for family standing beside. Mods and supporters along for the ride. Sponsors and friends who keep it alive. Truth in the word is how we survive. Then Peter said unto them, repent and be baptized, every one of you, in the name of Jesus Christ, for the remission of sins, and ye shall receive the gift of the Holy Ghost. On American streets. 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 On American streets.